Chair, your microphone is muted.
Yes, member. I'm fully aware, Member Michelle.
Oh, my apologies.
Thank you. I just wanted to make sure that IT was on top, Member Mitchell. Apologies for that.
Okay, Chairperson, we may continue. We are live. I think we should follow up with a question of Member Lekker had a hand up.
Yeah, thank you, Member Lekker. Before we continue, was there a hand that we saw? Member Pat Lekker. Last call, Member Pat Lekker, you had a point, you had a hand up.
Thank you, Chairperson. Can you hear me now? Am I audible?
Yes, I can hear you, Member Lekker. You had a point that you wanted to raise?
Chair. I actually raised my hand because I wanted to submit an apology.
Okay, we were going to get to the apologies now, Member Lekker. We're just making sure that we acknowledge anybody in the meeting. You can go introduce yourself and then note the apology you want to submit.
Thank you, Chairperson. Good afternoon, everybody. My name is Pat Lekker. I hereby submit an apology for Member Cameron Dugmore, as well as Member Denville Smith. Thank you, Chair.
Thank you. Members, can you introduce yourself? So noted, Member Lekker.
Good afternoon, Chairperson. Good afternoon, Chairperson and members. Wendy Philander.
Thank you.
Goeiemiddag, voorzitter. Goeiemiddag allemaal, Dylan Mitchell.
Thank you.
Good afternoon, Chairperson.
Good afternoon, Chairperson.
Good afternoon, everybody.
Thank you.
Gillian
Good afternoon,
Bosman here.
Chairperson Regan Allen.
Thank you. Also noted.
Goedemiddag, voorzitter. Rachel van Vogel.
Thank you.
Good afternoon, everybody.
Thank you.
Brett Heron.
Thank you.
Greetings, Chair. Melika Altrebo.
Thank you. Is that all members present this afternoon? Thank you. Can I give the opportunity to the Minister and her team to introduce themselves, please? Dr. Norma French.
Molweni, honorable members, and thank you, Chair. Norma French Mbombo and the team through Dr. Clute will introduce themselves. Thank you.
Thank you, Dr. Norma French.
Good afternoon, Chairperson. Dr. Keith Clute, the Head of Department, Western Cape Department of Health. I will ask the other department members to introduce themselves. Thank you.
Good afternoon, Chairperson. It's Dr. Krish Vallabhji, Chief Director for Strategy, Department of Health. Thanks.
Anybody else from the department?
Chairperson, that's only us. Thank you very much, Chairperson.
Thank you and welcome members and the department for joining us. I've also received apologies from Mr. Gerard Odendaal, who the chairperson of the South African National Association for Special Education, SANASE. They will submit their report, and Mr. Henry Botha, and I note that Mr. Tony Marshall is attending this meeting this afternoon and representing for FEDAS, which is the Federation of Governing Bodies of South African Schools. Just for the rules of engagement going forward, members, do I hear a hand up there?
Apologies, Chair, but on a best time, I was studying to unmute myself earlier. I'm also attending the meeting. Thank you.
Okay, Mr. van der Mesthuizen, your presence is noted. Thank you very much. All members are going to be muted at the beginning of the meeting to avoid background noises. Members of the committee who wants to flag a point of order can do so in the chat function under MS Teams. Can I please request that all audios and video to be switched off to improve the quality of the connection? However, if somebody speak, a member, the minister, the HOD or any official, please put on your mic and your video so that we know who we're speaking to. And please can I ask all participants to switch off their mics once they've finished speaking. The point of order will be directed in terms of the ATC of the 17th of April, Section 8, which states that when a member is considered to be out of order by the presiding officer may mute the mic of such a member and call such a member to order. We are going to receive a briefing by the Provincial Department of Health this afternoon. If I can request the department and the minister to keep it to a maximum of 30 minutes. After that, we'll take questions from the relevant parties, as we normally do in this committee meeting. And we'll then have the department also give them an additional 15 minutes to respond to those. And after that, we'll receive the briefing from Mr. Lebogang Monjante, who's here this afternoon, and also from Dr. Malka Fente and his team, Mr. Tony Marshall. And then we'll also have a question and answer session as we normally do in this committee. So I'll hand over to the minister just to introduce this conversation, and to the HOD and his fellow colleagues to do the presentation. I see there's a hand up. Mr. Windvogel, is that from earlier on? Should I lower your hand? Lizette Kluter, I see your hand is up.
Yes, Chairperson. Member America submitted his apologies on an oversight visit with the SC on Human Settlements in the West Coast area.
Thank you, so noted. Honorable Windvogel, is that your hand up? You got a point of order or question? Honorable Windvogel? Okay, no response from Honorable Windvogel. Minister Mbombo, you can continue.
Thank you, Chair. So that we don't waste much time and also we could be able to have much time for engagement, Dr. Klute will do the presentation. But just to flag that, noting that the invite was on the 28th July. So in the context of the COVID, 7 days is 7 years. In regard to there could have been many things that have changed. And it's inclusive of, for example, the isolation period and all of those and where we are. So we have to consider in terms of even with the questions that the member might be asking. So if you're going to ask us about what happened 2 weeks ago, things might have changed, as we know that it's a new virus, inclusive also in terms of what we're presenting now. It doesn't mean that if you say the containment strategy is going to be ABC, and then tomorrow, if there's an outbreak or if there are any changes in terms of the epidemic, we cannot be able to change. So it's the issue about the flexibility and also moving with the flow. Thank you. Over to you, Doc.
Thank you very much, Minister, and thank you, Chairperson. Chairperson, can everybody see the slides?
Members, can you see the slides? I can see it.
Yes, Chair.
You can continue, Dr. Klute.
Thank you, Chairperson. I will do justice to the 30-minute limitation. So I will do an update on the cases, hospitalizations, and mortality observed in the Western Cape, a very rapid update on the hotspot containment strategy, an update of our testing capacity, and then an update of our acute service platform response, and the review of the health system response, and the reintroduction of comprehensive health services, and a few concluding remarks. On the update of the cases as submitted to this committee, we gave an update of Sunday, 16th of August, was the latest update that we gave. That is when we had a total cumulative amount of 100,000 cases in the Western Cape, a total amount of 450,000 tests done. At that time on Sunday, 6,332 active cases and 90,871 recovered cases. And as at Sunday, 3,573 deaths. What we also show you in this daily report, because that's a daily report that we make available to everyone, you could see how many cases are recorded per day. So as of that day, 2 days before, 560 cases, 402 and 434. We also then, on a daily basis, as I say, update this data as we go. Just on case and contact tracing, approximately 50% of cases occur in the private sector, and the majority of these cases and contacts are followed up by the private doctors taking care of these individuals. So the contact tracing and case tracing has become a very decentralized system. Workplace contact tracing, conduct case and contact tracing among their own employees, and they feed into our system. Approximately 10% of all cases utilize something called COVID Connect. That's our contact tracing application. It's a national electronic system. I believe this committee has been briefed on that system. All cases are called by a call center and a case management team. This will include the private and public sector patients. And while this does lead to patients receiving multiple notification, it helps us to cast the net as wide as possible. All citizens called are told to isolate or quarantine, and they are offered the state-provided isolation quarantine facilities. We are working on improving this data collection system and contact tracing to bring all these multiple things together in one collated system. So as of traced from 3rd of August to the 10th of August, it's estimated to be 7,100 cases, and total cases from the 3rd of August to the 10th of August offered Q&I that's the cases traced were 7,100, but all cases and contact traced offered Q&I in that same period was over 10,000. What we also want to do, and just to give you a picture of this, is the healthcare workers. So as of the 16th of August, we had 4,400 healthcare workers that, and this is specifically in Western Cape government, specifically, that were positive. We had 4,124 recoveries and only 260 active cases. We've had a cumulative 35 deaths amongst healthcare workers in the Western Cape Department of Health. The overall infection rate is just, it's 13.6%, and the recovery rate as of the 16th is 93.1%. So the infections had a peak in June and in July, but since then has declined into August. That gives us this integrated picture. The integrated picture is really about testing, cases, hospitalization, and mortality trends. I'll go very quickly through them. The bars that you see at the bottom, these are all the new diagnosis by definition confirmed via testing. So you can see there was a peak in testing towards the end of June and a gradual decrease of the number of positive tests into August. The yellow line that is immediately following this one above it is the case positivity rate. We can now gladly say to you that that is dropping to the vicinity of 15%. It is now a declining case positivity rate. The 50% means for out of every 100 tests we send, only 15 are positive and 85 are negative. The solid red bar is the officially reported cases of deaths. And that is the cases that we report on a daily basis. The dotted red line is the one that we think is the projected deaths. And we are working very closely with the Medical Research Council that release the weekly updates to make sure whether our reported deaths and the deaths that is reported by the MRC for excess natural deaths is close to one another. So we allow for a relative underdetection, but we're tracking quite well with them. The blue line is the number of COVID patients admitted, and you can see that that's a decline. And the dotted blue line is all the people under investigation. It's not COVID confirmed, but everybody that's under investigation for COVID, because not all of them would be COVID. The green line on top is quite an interesting one that we've added, and we know this committee is interested in that, and that is the daily oxygen use. And you can see also all of this indicates that roughly towards the end of June, beginning of July, we've had a peak, and since then, all of these markers have decreased steadily over the last 6 weeks. This is the Mrc comparison. The Mrc looks at all deaths from home affairs and what they call excess natural deaths. And you can see that our data that I've just shown you tracks very well with their data. This is a new feature that we've added onto our daily dashboard. And if you go into the dashboard, you can get a picture of every district and sub-district in the metro and individually see their own curve and what has happened in each area. So if I take the example of Khayelitsha, you will see that Khayelitsha's cases, increase in Khayelitsha was a little bit earlier, significantly earlier than Garden Route. And in Khayelitsha, the cases increase, and the cases since the end of June decreased consistently into August. And that's the blue. The red is the deaths. Now that's the deaths on this side and cases on the other side. And you'll also see that the deaths peaked towards the end of June and is decreased all the way down into August. If you compare that to Klipfontein, you compare it to Mitchell's Plain, to Northern, and to Eastern and Tygerberg, you see a slightly different picture for each area. Garden Route is an interesting one because Garden Route actually had the most recent increase of cases, and there is still a plateauing only in Garden Route now, which is roughly about almost 3 or 4 weeks behind the metro institutions, whereas Cape Winelands is in between, and Overberg and West Coast is in between. So Overberg and West Coast closer to the metro, Garden Route furthest away, and at a later peak in terms, and there's still some pressure in hospitals, which are starting to decline. And then Central Karoo, which is very small, the numbers, and it doesn't really feature well on these on this grid here, also had a recent uptake in cases. This is what it looks like. So it looks like multiple mountains, peaks. And the point we're trying to make is that each area's peak is slightly different from the other. And it's like a rolling peak of multiple mountains that gives us the composite picture of the Western Cape. The hotspot containment strategy, it's essential to impact on and continue to drive behavior change in every local community until a full vaccine program is in place. Now that potentially can take 12 to 24 months. Behavior change will be the key thing about uptake of masks, social distancing, hand and surface hygiene, and therefore the ongoing focus on containment, especially to detect and respond to potential emerging clusters, becomes an important thing for us as a health department. So we're currently going through a formal review process of index case follow-up, contact tracing system, isolation and quarantine, based on our learnings of the last 3 months. And that's all part of a larger review of our entire strategy. And in the space of the next 2 to 3 weeks, we're trying to bring all of those elements together in a revised strategy for the next 12 to 24 months. This is just an update of the Global Vaccine Initiative. South Africa is part of the international collaborative effort. You can see countries, including South Africa, were invited to participate in what is called a COVAX facility. It's an investment opportunity and there's seed funding. And we work with the World Health Organization, UNICEF, the Bill and Melinda Gates Foundation, and the World Bank, and a lot of donor agencies. And the idea is to pool the resources and support the production of vaccines. So when it becomes available, it is equitably available to all countries in need. And that is what South Africa is subscribed to. There's already 10 vaccines in clinical trials, and some researchers in Oxford and AstraZeneca, they hope to have the first phase 3 vaccine. So you go from phase 1 to phase 2, phase 3. Phase 3 is when you can start moving into giving it to people. Although there's many experts that argue that even 18 months for the first vaccine being available for everyone is an incredibly aggressive schedule, there are a few people that is optimistic that there will be some vaccine toward the end of 2020. But the majority of people feel it's probably we're talking 18 to 24 months in terms of having a vaccine available to all of us. To go on to testing capacity, the NHLS has no backlog at present for confirmatory PCR tests. There's sufficient PCR capacity in both public and private, and it means that we as a department can now review our testing criteria for the province. We have a technical team that's meeting, and towards the middle of next week, we are looking to revise our strategy for testing. We've had significant success with high-risk diabetic strategy, and we are now focusing on moderate and low-risk diabetics. I will touch a little bit later on that as well. And there's also a big national Serum Prevalence survey being planned with SAPRA-approved rapid tests. The NHLS, I've just had a meeting with them now. They're looking and they're busy validating the tests. And once those tests is available, this national survey will be done. And it will check how many people have been exposed to COVID. And we will then have a sense in this province, in the different geographic areas, what has been the exposure to COVID. NHLS has also offered to assist us with a big community drive to catch up on TB case detection. So TB tests over the coming months because we're very concerned that the test for TB has decreased while we were busy dealing with COVID. Key messages from the Diabetic Project. Of the total high-risk diabetic patients, we have contacted and admitted 39 people. Only 2 has had an adverse outcome of death. Now you have to take that against the backdrop of that risk group. The risk for them before is at least between 37 and 42% of people that had diabetes that was severe, that was admitted previously for COVID, died. Only 2 people out of this high-risk group that we're now managing died. After 2 weeks of the program, 18 patients were still in admission at the end of last week. Some of them have been discharged now. The remaining 19 have been discharged and are recovering well. The low-risk phase is we've taken some people and we've contacted them. The whole idea is we call people, and depending on their risk, there's a group of doctors. They have this patient load. So it's almost like getting a daily clinical consult from a doctor. And the results has just been overwhelming for the patients and in terms of outcomes and control of diabetes. To go onto the platform, so just to give feedback to everybody, the CTICC Hospital Hope had a cumulative admission of more than 1,500 patients, cumulative discharge of more than 1,400. And as of the middle of last week, there were 57 admissions. The preparations have started, and I can give feedback to you now that the last patient on Monday, the last patient left CTICC, and a formal decision has been taken that we will now start the decommissioning of CTICC to hand it back over to the CTICC by the 18th of September. So the last patient has been discharged. Patients have started moving to Bracken Gate. Their cumulative admissions into the middle of last week was 201. Cumulative discharges was 153. Their admissions was 54 to the end of last week. It is in this week has gone up to 78. And Bracken Gate will now admit more people, obviously, as CTICC has been decommissioned. The Tusong Center, very successful collaboration with Médecins Sans Frontières, had admitted 241. Discharged 194, had 34 deaths. That facility closed last week. MSF has taken their capacity that they invested in that center for 6 weeks and moved it to Butterworth in the Eastern Cape. Soonstraal, we're happy to say, has opened and had its first admission last week. There's up to 4 patients now at Soonstraal. And then there's additional beds. We had 60 beds donated from Gift of the Givers at Mitchells Plain at the Lentegeur premises. In Hermanus, Vredendal, George, and in other places, there are multiple innovations where our teams have added some additional beds. So if there's a resurgence in cases, we feel quite comfortable that without CTICC and without Tusong Center, we can cope with any additional upsurge in cases as well with the capacity that's been created. This is just to give you the occupancy as of Monday, the 17th of August. We had a total of 8,100 patients for all conditions in beds, with 3,800 beds available. So that roughly speaks that our bed capacity in this province was only filled to about 68% capacity on Monday. And the available beds was 3,804 on Monday afternoon. There are also the admissions and discharges from the 9th of August to the 16th of August. That's the week that we report to this committee. From the end of the 9th to the end of the 16th, there were 575 admissions. And for that same period, there were 651 discharges. So you can see it's in keeping with that decline of cases. We discharge more patients than we're currently admitting in terms of decreasing hospitalization. Oxygen consumption, another matter that you want us to report on. We can say to you that on the 10th of July, we were maximizing oxygen use. At that point, we were using 60% of our daily available oxygen. So at the maximum, we were using 60% of the available oxygen. Since then, it has declined. We're currently averaging at about 54% of total capacity. That translates into, at the peak, it was 30 tons of oxygen per day. That has become now less than 28 tons of oxygen a day. And it's really just to say that we have sufficient oxygen capacity throughout this to the peak, and we are now decreasing in our oxygen use. Our progress with the private sector, all private sector hospital groups have signed up. We have sufficient hospitals and specialists ready to accept patients should the need arise. 5 patients have been transferred, and that's largely been to test the systems of how it would work if more public sector patients were admitted into the private sector. Our strategy is still to exhaust our in-house capacity first. Given the current projections, the need to activate the referrals to private hospital has diminished. However, the systems and processes are in place should we need to access this capacity if there is an upsurge. So in addition to the capacity we still have, and the fact that we can also use the private sector capacity rather than keeping big buildings available and the risk is there that we don't use them, we're feeling very confident that we have sufficient capacity to respond if there should be another surge. The temporary mass fatality center is at Tygerberg Hospital. It is fully operational. There were 28 cases by Monday still in the facility. We obviously had built that facility to be able to make available for much more cases, but it's very well managed. It's managed with the undertaker capacity, the capacity at hospitals. So there's no challenge with managing the bodies as a result of COVID. And in the rural at the moment, when we are decommissioning CTICC, we will maybe move some of that capacity to where it's most needed in the rural, but the capacity is also sufficiently managed across all the rural district municipalities. The impact on alcohol ban took quite a bit of media interest. And really we can reflect, if you look at this graph, that 2 months prior to the alcohol lockdown, that was the number of trauma cases that presented to 5 hospitals that we use as sentinel hospitals to report on this. 2 months during the lockdown of alcohol, and the lockdown and alcohol ban, you can see a decrease of trauma cases in those 5 hospitals. When it was lifted in level 3 for 1.5 months, you could see an increase again. And the most recent alcohol ban of 4 weeks, you can see a decrease again. So basically what this showed to us is that the alcohol ban on trauma cases, there was definitely an impact of the alcohol ban on the number of cases presenting in the trauma. But as the burden for COVID on the hospital platform declined, and as the president announced that the alcohol ban was lifted as of Monday midnight, it becomes now important that we use this information to implement measures that decreases the social burden of alcohol. There's a good window of opportunity for us now to talk about that there is measures that we can do to decrease the impact. And we feel it in the trauma units, but it's also felt elsewhere in society. And these are some recommendations from the World Health Organization. And that is overarching and enabling actions to reduce the harmful use of alcohol. So it's really, the best advice is there could be some taxes on alcohol beverages. That's a national competency. And act and do some restrictions to the exposure for advertising. Again, it's a national issue. But enact and enforce restrictions on physical availability of retail alcohol. That's a local competence. And we need to look at between municipalities in the province, how we potentially can look at the physical availability of retailed alcohol. And then enact and enforce drink driving laws and psychosocial interventions for people that suffer from hazardous and harmful alcohol use. And there's quite a few other recommendations that we should be considering in the reintroduction of healthcare services. One of the important considerations would be that we would want to minimize the impact of alcohol on health system capacity. Surveillance strategy. So this is very important as we go into this next 12 to 18 months. It's important for us to be able to have surveillance in place. Now, just the definition of surveillance. It's a systematic collection, analysis, and dissemination of data. In this case, data on COVID-19, so that we can plan, implement, and evaluate our interventions. So surveillance aims to identify infections before they become outbreaks, to limit the spread of disease and enable public health authorities to manage the COVID risk. So there's a difference between screening, testing, and surveillance. And screening is really to identify the symptomatic people. So it's a symptom questionnaire. Testing is to diagnose somebody with COVID. And that's the test, the PCR test. Surveillance is to determine what proportion of people of the population has had recent or past COVID infection. And those are mainly the introduction of blood tests for antibodies for IgM and IgG, and that's the test that we're talking about for the serum prevalence that will be coming out soon and that we will be using in the Western Cape to determine what the exposure has been locally. Possible approaches for surveillance. We are looking at the population survey. The Human Sciences Research Council and the NICD are doing a massive household survey, and we are participating in the Western Cape like all other provinces, and they've afforded us the opportunity to work with them. Then when the survey is done here, we might want to expand the survey to give us a very detailed picture of this province, so that when we use that survey, we can have a very clear understanding of what the exposure has been in the Western Cape. Routine surveillance, that means we can use blood that's taken for other reasons, and the classic one is all women that's admitted for pregnancy has a blood sample taken. So we could use that blood sample to look at what is been exposure of COVID there. Then surveillance in specific places like long-term care facilities, old age homes, prisons, and then also amongst healthcare workers, a very important one that we want to look at. Novel approaches is that the city of Cape Town is also looking at wastewater based epidemiology. So what they do is they can detect COVID of the wastewater on the grids. And that potentially would also help us to say, hang on, there's COVID in this area. We can isolate it to an area to see whether there's. So if we put all of this together, it will help us to be able to keep an eye on where COVID is and whether there's any outbreaks. This is not something we had in the first round. We now have this to help us for the next 18 to 24 months. This is an example from Mumbai, where the serum prevalence was done. And this is just the yellow blocked one, is just to show you. When they did the blood sample, the rapid test, in the slum areas in Mumbai, 57% of people were exposed to COVID. But when they did it in the non-slum areas, that's the built-up areas where people had formal housing, only 16% were affected. So we're going to get these kind of results out of the survey, and it will tell us what the risks are and the exposures being in terms of managing going forward. The last point we want to bring is the reintroduction of comprehensive clinical services. So as of the first week of August, we have already started introducing comprehensive clinical services, and the following principles guides that. It's data-driven. So we've learned from COVID to say, and I've just had a conversation about the TB data. So we want to say, this is what's happened to TB. What is the targets for TB? Let's set it in place. The same with immunizations for babies. What has happened with immunization? What is our targets? Manage it accordingly. And so we will go. Elective surgery, cataract surgeries, all of those kind of things, so that we can set our targets and introduce the services that, in a sense, had taken a dip during the first 4 months of COVID. Also technology-driven. We've learned so much about delivering medicines to people's homes. We want to leverage of medicine delivery to home, rather than let people come back again to our facilities to sit and come only to get their medicine parcel, especially the elderly. And it's really also about really being person-centered and looking at the dignity of the older person, having to sit and come and to go through all of those things. Then also what we say is this risk and impact approach. I've just used an example. If we don't immunize quickly, we could be at the risk of an outbreak of communicable disease amongst children. If we don't do something about TB, we could have an impact of TB. So that's the risk. And if we do those things, we can have a big impact on the healthcare system. So we must do the things that has the biggest impact, the quickest in terms of that. Phased approach, we're saying that the next 6 months is short term, 6 to 12 months is medium term, and more than 12 months is long term. And then we also have to think about students and the research coming back onto the platform. And then the last thing is, what is the very innovative way that we apply the supply chain for PPE during COVID? How can we do supply chain for all the other things that we need it for people management and infrastructure? And then we are doing this review. The purpose is we're constantly looking at what we want to do. We want to learn our lessons of the past 4 months as we map our path for the next 12 to 24 months. And we're saying we're going to look at containment. I mentioned that. Our health platform response, our corporate response, including occupational health and safety, about focusing on staff. And then our health intelligence and our learning thing, which has been a big thing for us. And then governance for health, and that's working with other sectors in the whole of society. We will do that over the next few weeks, and we want to invite diverse voices and perspectives. The Minister is planning to have a series of engagement with people that we can get their views to help us to actually learn from this and also connect with people and incorporate their views in what we do for the next 12 to 18 months. Suggested questions is, what impact, positive or negative, have we had? What have we learned, positive and challenges? What is our strategy for a comprehensive approach over the next 12 to 18 months? How do we want to do business differently to sustain agility and responsiveness? And what are the key enablers and barriers to sustain gains? So in conclusion, our cases, mortality and hospitalization has continued to stabilize with varying levels of maturation, the different mountains that you saw. The health response by and large has coped with cases during this initial surge. There's been significant capacity added in terms of infrastructure and equipment, especially for high flow nasal oxygen, and we've managed the oxygen. We are in a position to contact the private sector if required. The introduction of comprehensive services has been scaled up from the first week in August in a balanced manner, but it is so essential for us to have a strong focus on containment for the next 12 to 24 months until there's a vaccine. And we are conducting this formal review and reflection to develop a coherent plan for the next 12 to 24 months based on our learnings. And thank you very much, and we would welcome the reflections from the ad hoc committee on our experience of the last 4 to 5 months and invite comments into our strategy going forward. Thank you very much, Chairperson.
Thank you very much, Dr. Klute. Dr. Mboma, anything else you want to add before I continue?
Chair, I'll suggest we just probably provide an opportunity for the questions, because it's quite a mouthful that has been presented, and then it's about more than 5 areas. So I think let's wait for that part of it instead of adding. Thanks.
Okay, thank you. Members, while you get yourself ready for your questions, as we do normally, I just want to take this opportunity to ask our guests who's presenting afterwards, but they are with us, just to introduce themselves. Mr. Monchane and Dr. Fenter, just introduce yourself by name and your organization, and please switch on your camera so we know how you look like. And then you are joining us later, but I thought seeing that you are here, you can introduce yourself. Thank you.
Good afternoon, Chair. Thank you very much. My name is Lamokham Manjane. I'm the Executive Director of the Independent Schools Association of Southern Africa.
Thank you, sir. Dr. Fenter.
Good afternoon. My name is Malcolm Fenter, and I'm the Provincial Executive Officer of the Governing Body Foundation for the Western Cape.
Thank you very much. We will speak with you in half an hour or so. If I may ask you just to switch off your cameras, please, and then I'm going to hand over to the members of the committee to ask their questions. I'm handing over, members, you know your time that you've got. I'm handing over to the DA for your 3 minutes. Thank you.
Chairperson, thank you to the department for their update on the Western Cape Health Strategy. Chairperson, as more people return to work and considerate of the fact that employers conduct case and contact tracing of their employees, the HOD made mention of the decentralized approach in this regard. Chairperson, is there any assistance or directives or guidance to the sector from the department side to ensure that the pandemic is contained and ultimately we do not incur a second wave of infections? And then, Chairperson, I also note with thanks that the department's hotspot containment strategy as well, and the review thereof, and then ultimately, which is largely driven on behavioral change. Chairperson, especially pertaining to non-metro areas, is there any additional measurements that will be put in place in this regard? That's my question for now, Chairperson. Thank you.
Chairperson, if there's extra minutes, I will take it from the DA. You are muted, but I assume that you can hear me.
Continue, sir. Member Regan.
Thank you so much. Firstly, well done to the department considering the decommissioning of the CTICC, and obviously that capacity will be moved even to other provinces. But Chair, I would like to latch on with regard to the reliability of community surveillance, as indicated on the slide through serology testing. If the committee is able to hear, firstly, A, who owns the testing kits? And then B, if the department has any reasons behind National Health centralizing it, it would be interesting to know why. Thank you.
Thank you. I hand over to the ANC. The ANC.
Thank you, Chairperson. Can you hear me?
Yes, Member Van Vogel, you can continue. Your 3 minutes starting now.
Thank you, Chair. I think we welcome the presentation by the HOD. From our side, or from my side, I'm just a bit concerned with the issue of the closing of the Hospital of Hope. My question is it not too early, especially while we are we just moved to level 2? That's the first question, Chair. Then the second one, given the fact that as the department, we believe that we are winning the battle against COVID-19, what foundation has been laid to address all the factors that led to high infections in the hotspots? And then with regards to improving healthcare in the hotspot, what is the number of healthcare workers that have been employed permanently? And in the healthcare workers operating in the Hospital of Hope, how many were employed from other provinces? And how many will be sent to different facilities in the hotspot areas? And if, how many seasonal workers were employed and what was the cost of that? Thank you so much, Chair.
Thank you. The ANC's still got time left. Okay. Further question from the ANC on their time left? Okay, I move over to the EFF.
Well, yeah, thanks, Chair. I think mine it would be on the acute services platforms, noting that some of the institutions would be closed, and of which it's understandable in terms of workload. But now what I wanted to check is that now that we know we've been struggling with the public healthcare system, that in terms of facilities, and therefore if these resources could be kept for permanent kind of arrangement in order to improve our health system, so that we don't demolish everything and say, no, now we are past the COVID-19 and therefore everything. We know how we struggle with TB and other related challenges. And also, I just wanted to check in terms of your research for surveillance strategy. Now that we have noted that there were serious challenges in terms of vaccine, some institutions such as educational institutions such as Stellenbosch, UCT, if the department has worked with such kind of education facilities to be able to get, say, a research perspective from Western Cape in terms of our understanding as far as to how do we explore a vaccine. Thank you very much, Chair.
Thank you. The EFF, I recognize Good.
Thank you, Chairperson. I want to start with the curves that we're seeing, or the graphs we're seeing across the board, the daily cases, the deaths. And I'm wondering if the department has done any modeling or trajectory as to whether we are heading towards a virus-free province. Does the curve take us all the way to zero? And in that context, Dr. Kluti started or concluded by talking about an initial surge. And does that mean that he's anticipating a resurgence or a second wave? And what are the details of that? Does the modeling take into account the relaxation of the lockdown that we've just seen, and how would that impact on the curves and the test and the positivity rate? Then regarding the testing and the review that's underway with regards to the testing criteria, why are we reviewing the testing criteria, and does this imply that we have many hidden cases that we haven't discovered because we had those testing criteria in the first place? With regards to the CTICC, I was wondering, it had an 800-bed capacity, if I recall. What was the peak admission? What was the highest admission during the period it was open? And then finally, with regards to Brackengate, what is the capacity of that facility and what are the costs of operating it? Thank you.
Thank you, Member Heron. I recognize the ACDP.
Thank you, Chairperson. Chairperson, a question is that is the department sure that each and every area within the metro and outside the metro has reached its peak? Are they sure about that? And that's all the curves showing downwards, so there won't be, an area that will hit a peak at a later stage. And also, I also want to latch on to the other members when it comes to the second wave of infections. Are we sure, and is the modeling showing that there is no chance for a second wave of infections, or that's why they're closing down field hospitals? Question. And then also, did the department have any discussions with other departments concerning what the head of department said about the alcohol, the availability of alcohol? So we know that there's competencies on the national, but when it comes to the provincial or local level, is there that type of engagement to say, listen, if we want to manage the situation correctly, we need to do so? Are they in discussion with other departments? And maybe just the last question, it's almost the same as Member Helen was saying, but when do the department have maybe, when will we stop with transmissions, with more infections? Is there a date like that? And I heard maybe the middle of next month, we might see, it going flattening severely. Is that true? And when we will see that flattening of the curve completely? Thank you, Chairperson.
Thank you, Member Christians. I recognize Al-Jamaa. I recognize Al-Jamaa. Okay, we move over to the Freedom Front Plus, Member Mrc.
Thank you so much. Doctor, you must know that I was vehemently opposed to converting the convention center into a hospital. Said it was money wasting. There are other cheaper options. So what influenced the decision to close it now in September? Is it hindsight that Freedom Front was correct and the DA was wrong, or what was the reason? And can you tell me what is the average utilization efficiency of the CTICC? I mean, when I say if you had 800 beds, what percentage of that beds were ever occupied at any particular moment, taking an average over the past few months? And then lastly, I noticed, and I must compliment the Western Cape Health Department for the high recovery rate. I think we beat the country by far. We must be now 90%, if I'm not mistaken, by now. And if that being so, how does that recovery rate compare to the successes we've had in HIV, the successes we've had in tuberculosis combating, diabetes and cancer? Is the hype about the seriousness of COVID over-dramatized? If you think how many people die of HIV, TB, and flu, are we causing panic unnecessary amongst the population? And are we spending equal money on these other epidemics than on this pandemic of COVID? I'm getting a bit concerned, Doctor, that we are neglecting the others and concentrating too much on COVID, where there's already such a high recovery rate.
Thank you, Mr. Mrc. Dr. Klute and team, that is all the questions that we have. Can I just add one item to that, please? And I'm going to try and simplify it. I know that Honorable Heron and Honorable Christian touched on it, and I'm going to try and perhaps simplify the way I would like to understand it. If we change the testing criteria, assuming everything stays the same going forward, are we going to get different results? Simple as that. I'll hand over to your team and the Minister to answer those questions. Please also note that you have 15 minutes. Thank you.
Okay, 15 minutes. So it means I'll just do the combination of general response, and then the HOD can take those that are relevant.
Yes, thank you, Minister.
Yes, regarding to the sector readiness, if you recall, at the level 5 lockdown, that's when actually essential services sectors were open, which resulted into cluster outbreaks. So it prepared us to have engagements with the economy department and also other departments in preparation for their sectors. So hence we have got many circulars, inclusive actual other sectors like correctional services, South African
Apologies,
police.
Member, Dr. Mbombo, Minister, Member Mrc, can you mute yourself, please?
I was about to say that.
Yeah.
I was about to say I'm worried about that cough. I'll call him later just to check doctor's rounds. Okay. So we already have the sector readiness protocols in place. But there are some of the sectors where probably might not have opened during that time, like the informal traders, sex workers, the gym, where now together with the Department of Economy, we're looking at those, and I'll be visiting some of those as well, just to check their readiness, inclusive of some of the restaurants that were there, but the protocols are already there. With a question about in terms of the testing, currently with the Southern Health System, the National Health Laboratory is a national competence, and then they've got branches throughout the provinces. We do pay them for each test, not only now during COVID, but any other test, for the blood test and all of those, we're paying them. With the testing kits, it has been their custodian. If you recall, there was times that we had a backlog of the tests reagents, because at the time they were sourcing from the international community, which is US at the time, and also some parts of the Europe, were the ones who were monopolizing the whole of the international world when it comes to the testing kits. You may recall that Minister Patel at the national level, together with the help, they were exploring part of how they can empower South Africa to have those kind of factories, not only for the test, but also for the ventilators and all of those. But at this stage, everything is centralized and we're paying them. And ideally, for example, in the Western Cape, where we initiated the blood service as provincial, it doesn't stop probably in future for the provinces to explore such, but at this stage, it is a national competence. In terms of the surveillance kits as well, because it's part of the NHS, so within the provinces, we make an assumption that it is going to be like that, as it has been with the PCR testing and the regions, which is they have centralized. Just roughly about the Hospital of Hope. Members, Honorable, must understand that when we talk about this, it is a field hospital, which is, it has got a limited responsibility. It's mostly, or it's specifically for the intermediate care package, which is as a step down for those people who have been admitted at the hospital, but they are not ready to go home in terms of their condition, but they are well to be out of the acute bed hospital. That's what it was meant for. And most of the referrals, they were coming from Provincial and also from the Mitchell's Plain. Whilst with the now Khayelitsha, we had the Tucson, which has already been closed, with the Brackengate now is taking over. This is not the only intermediate care facilities for the COVID. We made an example of the Sonstral, where now phase 1 has already been opened. Others, for example, the Hermanus Hospital in Overberg for the 32 beds, the Harry-Comey Hospital in Garden Route in George for the 40 beds, the Vredendal Hospital, also the addition. So what we are trying, and also some of the acute hospital beds, you find that they're being accommodated. For example, Mitchell's Plain also received extra beds through the gift of the givers. Stellenbosch Hospital, they are also adding. In addition to that, within the existing hospitals, as I made an example, you might have other beds like palliative care beds. So we have never been short of acute general hospital. We have never had those. For the first Hospital of Hope for the intermediate care, it's only for the COVID cases at their intermediate care, which now we could be able to afford as we are opening up some of the other field hospitals throughout. And it makes sense now that we could be able to link the whole of the referral pathway to people. Let's make an example in Stellenbosch, where we'll find that it's already next door to the Stellenbosch, it's in the same yard. One could be able to do all of those. And then the other issues about, before I give it to the HOD, the other issues related to what about making use of these resources for the continuity, especially, which is through member Ngonde Taigo, that even before the COVID, our health system was under pressure, where we find that people will wait for beds even for 5 days, like in some of the hospitals. It doesn't, now that also lockdown level 2 are there, we have seen that some of the construction, the contracting will be open. Like, for example, I was in Garden Route, where now it's confirmed that some of the clinics, the extensions that we planned for will continue. And part of the plans, it was also the Tygerberg Regional Hospital, and also the Klerkfontein Regional Hospital, and also in other areas, for example, in Avian Park in the Brede Valley, some of the commitments we made, and the ambulance station and all of those will still going to be part of the package. However, because now we are in a period where we also want to test some of the components of the universal health coverage.
Apologies, Dr. Mbombo, to interrupt you.
Yeah,
apologies for that. Mr. Marshall and Mr. Williams, can you just switch your cameras off for now, please, gentlemen? Thank you.
Sorry, Chair. The last part. So the mere fact that COVID gave us also that opportunity to engage with the private, especially on the critical care beds. So now, because we could be, although we haven't used them except for testing the system, now that in terms of we know how to contract the private for the COVID, for the critical care, it doesn't stop. If it so happens that we have got emergency, for example, where you'll find that those people might need the critical care instantly, where we don't have the beds. It doesn't stop us now to look in terms of what kind of referral system pathway we can be able to utilize. Of course, taking note that the negotiations of the tariffs for the public-private, those are determined at the national level. The current tariff that has been negotiated by the National Health Minister with the private, I think it's about 16,000, is only for the COVID related to the critical care and also other packages related to that. But if need be, if now that in terms of the non-COVID cases, we want to continue when we have got such, when we don't have the resources, it will need to be negotiated at that level. Same applies with the universities, medical schools, and also others, nursing and all of those. Remember, they are part of us. We do have the joint appointments, some of the staff, but we work throughout with them. So the issue about at what extent that we can be able to utilize all of those aspects. I think I'll leave the other ones to the HOD related to the testing criteria and all of those, and then I can add if there's any, because I don't want to chow all the time, and then the HOD end up not having something to say. Thank you. Dr. Klute?
Thank you very much. Thank you. Dr. Klute, you can continue.
Chairperson, how much time I have?
I would prefer that you answer all the questions, but be mindful of the time.
Okay, thank you, sir. So thank you very much. I will just touch on then to very specific questions that came out of the Minister's general answer. Just to say to Member Philander that in the part of the mitigation strategy review is to look at our behavior change strategy in every geographic area. That includes every rural district and sub-district and area. So we definitely are looking at that mechanism as well, and we will enhance mask uptake and all of the behavior change in every geographic area. There's a few questions about CTICC. I'll do it all together. So just to say that CTICC was commissioned for 860 beds. At the peak, at the highest utilization, we used 400 beds. So just about half of the beds was used. And if I then put in terms of how many staff members we employed, our plan was to employ 600 staff, 900 staff members. We only employed sufficient staff members to be able to manage 400 beds. So we never employed additional staff over top of that. And then there was a question about what's happening to all the staff members. Each of the staff members have been given opportunity to be redeployed to the Southern Cape, to Eden and Garden Route, because the pressure was there. So many of the staff employed at the CTICC has actually been interviewed and appointed to work in Garden Route. Many of the staff anyway were on short contracts. And the question was how many of the people that were on short contracts were from other provinces. A big proportion of the nursing staff is from KZN. And they were always just here on short contracts. They previously worked for agency staff. And I can tell you that our use of agency staff has radically reduced during this period of time. So it's an all short contracts, and we are offering everybody the opportunity to be able to be absorbed in other places in our organization in accordance with staff needs. I think the big question was whether that, and Minister touched on it, it was specifically, Member Mrc, to cover a specific period, which happened to be the July period. You saw the peak of that, the June-July period. So we made sure that at that peak, we had sufficient capacity that we didn't run out of hospital beds on the rest of the platform. It was exactly the same time when all the private hospitals and all the public hospitals were running to full capacity. And in hindsight, it is still the right thing to have been done, but it was for a specific period of time. And now, because the Minister explained all the other capacity we've done, it's the right time to say we're not extending any contract. Our contract was until the middle of September. Therefore, we can vacate the place and hand it over in accordance with the initial contract, which was only to have it for a certain period of time. I think the question was, what's the capacity at Brackengate? The capacity at Brackengate is for 330 beds. As I've indicated, Brackengate were running with about 50 patients last week. So you can see there's a lot of capacity in Brackengate. And it's running at about 70 patients this week. So it's far short of the 330 capacity that is in Brackengate. So with all the things we've said and we've put in place, we believe that that capacity plus the additional capacity the Minister is talking about, that is sufficient if there's another surge. So let me go on to the surge question. Member Christian, we believe that every geographic area has reached the peak. Some geographic areas are further down along the peak. As I have explained to you, Khayelitsha is probably the furthest down from the peak. Every other place, the one that's closest to the peak, that's only starting to come down, is now in Garden Route. So Garden Route is on the one extreme. They're the most recent. Khayelitsha was the earliest. Everybody else in this province is in between. And we believe everyone, including Garden Route, has started hitting its peak. I think that the issue was that we are aiming, and we're sitting with the modelers, and it's a very good question from Member Heron and Member Christian. The modelers modeled, as you could imagine when I presented you previously, much higher scenarios than we actually saw. So we had fewer cases at the peak than was originally modeled. So the question was, so why did that happen? So they're busy going through very complex conversations, but they are acknowledging that there was an overestimation of how many people were susceptible to COVID. That's the one thing. The second thing is that it was moving at different paces, and there was impact of behavior change from time to time. And what we are now asking them is, with the surveillance strategy, our surveillance strategy, Member Heron, is that we would like to have a situation where we go to a lowering of the peak to very close to no new cases or no new cases at all. We would like to go there. And our proposal is we must work from a strategy that we want to keep it there, that we don't want a second surge. That's going to be hard work, but we want to go there. We're saying if on an off chance that we do have small outbreaks, we want to then, the next step is, if there's a small outbreak and there's small cases, we want to catch it early, make sure that there's not a big outbreak. And so that's what we're working on in terms of our strategy going forward. I think there was some other questions that I might not have asked answered. Oh, there was another question from member Christians. We are in communication with community safety and with the economic development, and we're definitely working from the alcohol impact from the point of view that it's been proven that alcohol impacts on the healthcare platform. So we, from an economic perspective, understand that the wine industry must go back to where it should do, but we're very strongly working with those departments that there must be regulations or restrictions that enables us to minimize the impact on the healthcare system and society in general in terms of the impact of alcohol. The last question from member Mrc is, it's a very astute observation, sir. We have done comparison. We have looked at all the deaths per 100,000, a very interesting slide. And we said, if you take COVID and its deaths per 100,000, how does COVID compare to the deaths per 100,000 we experience from other diseases? It only comes about fourth or fifth. You could predict, and you were right, HIV and TB is higher, then diabetes, hypertension is higher, then comes violence, and COVID more or less comes at the same place as violence. So it is a wake-up call for us to say, for COVID, we've done this big response because it's got a general impact across the world. We've done that response. What we now need to learn is, how do we learn from that to say that we not just go back to the way we deal with TB and hypertension and diabetes and HIV? How do we do better? How do we draw from the COVID experience to really get on top of all of those? And not to mention mental health, because people don't necessarily die, but mental health has got a big impact in terms of us. And then the last question, Chairperson, you asked it, and Member Heron, was the issue about the testing criteria. The reason why we're saying the testing criteria has to change is we specifically made a very deliberate decision at the peak of the cases that we had to preserve testing for people that are vulnerable. So we made a decision that people are generally going to be young, that's going to have a self-limiting illness, that we preserve the testing capacity for the ones that's in hospital, for healthcare workers and people with comorbidities. The reason why we're changing the testing criteria now is to say we have come out of that. What is the appropriate testing criteria for when you want surveillance to keep cases away? That is it. So it's a completely different set of testing rules. And we've got 4 preliminary things, but it's really geared towards not just safeguarding vulnerable people in the midst of a very severe outbreak. It is about picking up early and making sure that there is no outbreak. So it's a different flavor. If we change the testing rules right now, Member Mackenzie, we would find more cases, but it would be in proportion to the cases that we see elsewhere. Generally, healthcare workers, is that picture I showed you with healthcare workers, would be exactly the same for the general population if we were testing everybody. Thank you very much, Chairperson.
Thank you very much, Dr. Kluter and Dr. Mbombo. Members, was there any question that has not been answered? Okay, it seems that all questions were answered. Thank you very much, Dr. Kluter and Dr. Mbombo. Dr. Mbombo, you wanted to say something?
Just going to, it's important that that question, whether are we sure for sure that we won't have any surge? We don't know. We don't know, because if you look at it, in New Zealand, they had 0 cases for almost 100 days out of the blue, and then they had. Same applies with South Korea. They had fewer cases, and then there was a church gathering, and then it just shoot up to 300. Same applies in Australia, in Melbourne. Same applies in Singapore. So we don't know, but what we know for sure, it's about the virus is there, even if we don't test as many. That's why I keep on saying that the number of cases that we get in terms of what the national and also us we share is not a reliable determinant to understand how far with the epidemic. But what we know that because we have gone beyond the hotspots, which is where potentially everyone, including myself and everyone, that you are positive, take yourself as being positive. Hence, we have to stick to the behavioral change. But what matters is about based on hospitalization, on the number of healthcare workers infected, and also in the number of deaths, it does show that it has peaked. And then we've seen days where there was the highest number that we have ever admitted. But also, I think HOD forgot to include that in the deaths, we also look in terms of the natural deaths that may be COVID or not, that will have happened outside the system, which is on weekly basis, they are engaging with the MRC so that we can see out of those, because in the Western Cape, we found that there were about 1,000, they managed to locate about 500 out of those, where they can say, oh yeah, these ones we did conduct in terms of the death certificate, the certification of the death, although the issue of a person having an ID or not and all of those, it can take long. And then it gets picked up by the vital registration through the Home Affairs. Thank you.
Thank you, Dr. Mbombo. There was one hand up, Member Mrc, was from earlier on before we conclude on the Department of Health.
Chair, thank you. If you will indulge me, that I can ask the Minister a direct question.
Is it a follow-up question or a question that has not been answered, Member Mrc?
This is a linkage question to the question that Dr. Kluti so well, he answered it very well, but linking onto that, let's say this is the 8th man in the scrum. Could I ask that question?
Quickly, Mr. Member Mrc, we need to conclude.
Thank you. Minister, I've heard now, and I'm very happy with the way your department has handled the COVID-19. That the recovery rate is so high. You should be complimented on that. But taking into account that COVID is only 4th and 5th in line after tuberculosis, after diabetes, after HIV, are you going to continue to spend 90% of the money on COVID and leave the other people to die because it is not so fanciful as COVID? Or are we going to see a turn around in budgets to make sure that these others are addressed? Because there is a far higher recovery rate in COVID than in others.
Thank you, Member Mrc. Thank you very much. Dr. Mbombo, you want to conclude on that, please?
Sure. I think quickly, I got reminded that where I was in Mrc in Garden Route in George, which is a TB hospital for resistant TB. There, when I was asking that, because Mrc is where you get these resistant TB, and then I'm asking where you find that the bacterial infection, because TB is caused bacteria, which is through airborne, meaning in a room full of people, you are likely to have TB than in a room where you have the COVID that at least you wouldn't be unless you are in the close proximity, because at this stage, the evidence is still emerging whether it's airborne or not. So I was asking them that why it seems as if that they don't put much emphasis now on the TB, which is a resistant TB, and that they are building more wards for the COVID. Of course, also there are also wards for the combined patients who are resistant TB plus also the COVID. So what they explain is about, at least with the bacterial TB, which is bacterial infection, you can open the windows. You can, and also you can be able to do as much of the mitigation. The issue about the COVID is about, am I going to the room where there's no one? But member Ricardo Mackenzie will have been there, being infected, and have touched a table or whatever, and then I end up touching it. That's where the problem is. It is highly contagious and it's difficult to manage. That's why the behavioral change for the communities, because us as health, we might not be able to do as much actually, because people are getting infected in their homes. People might get infected in their home environment, or in their work environment. Whereas at least with the TB, open the windows, and then you know that when there's a cough and whatever. But here, when it comes to this, so remember, Mrc, is the issue is about it's high contagious. And actually, if we haven't done anything, actually there have been many people who have died. In South Africa, our advantage, our privilege for the first time that South Africa will be privileged when it comes to the health status is about we have got a young population. And then we've seen in other countries, like in the Italy and all of those, they've got an older population. We've got cardiovascular problems like the diabetes as compared to South Africa. Yes, indeed. So that's why the OHOD was saying that we have to reintroduce the non-COVID cases, especially for the TB, especially for the HIV/AIDS and immunization for the children, because they're not going to school, they're not ended up be able to be assessed. We are going to reintroduce bit by bit. We might introduce some of the operations, such as the cataracts, eye operations, and all of those. So that's where things are. Thank you, Chair, and thank you to the members. After this, we are done. Hey?
Thank you, Dr. Mbombo, and thank you, Dr. Kluter, for your time. It's really fascinating and always insightful listening to the Department of Health and the work that you've done over the last while during this very difficult period. I think history, many students will write their PhDs on the work the Western Cape government has done. I mean, that goes without saying. It's really incredible. I've been following this, obviously, not only in the country, watch CNN, Sky News, and see what the rest of the world do. And the Western Cape has really been innovative, if I have to say it myself. So thank you very much for the work that you've done. Keep on fighting the good fight. And I think the reintroduction of the comprehensive services that our communities has been waiting for is really welcome, because that is what's needed. So thank you for your time. Thank you, and say thank you to tens of thousands of health workers out there fighting the good fight on behalf of all the people of the Western Cape. So thank you. You are excused. Members, we are going to take a 3-minute leg break. We'll be back at 14:26, where we continue with the rest of the presentations. Please just mute yourself, and please do not leave the meeting so you don't have trouble into dialing in again. We'll continue with the rest of the presentations in exactly 3 minutes. Thank you. convene this meeting, the Standing Committee on on COVID-19, the ad hoc committee on COVID-19. We are back. Is everybody back? Can we reconvene? Maria, I see your hand is up. I'm going to put it down. I presume that was from earlier on. Lizette, are you here?
Yes, Chairperson, we may continue.
Thank you. Members, we reconvene the meeting, the ad hoc committee on COVID-19. Thank you for joining us this afternoon. It's now 26 minutes past 2. Members, just on the health presentation, you're welcome to send any follow-up questions or anything that you feel that hasn't been clarified during the presentation. It needs to reach the committee coordinator by Monday, the 24th at 12 o'clock. Lizette, am I correct?
That is correct, Chairperson.
Monday, 24th of August. If you want to send also additional questions that you feel the department need to start. Lizette, I want to make sure that we do have the presentations ready for our colleagues. That's going to continue next.
Yes, Chairperson. Mr. Mtonjane, I'm not sure if Amy or you are going to screen it, or do you want us to screen it?
Chair, I can screen it if I'm allowed to.
Yes, please screen it, Mr. Monjana, just to be sure that you can manage it from your side.
Is it visible, Chair?
I can see it, yes, I can see it, yes. Thank you very much.
Perfect.
Members, Mr. Lebogang Monjana is the Executive Director of the Independent Schools Association of Southern Africa. We've been part of our public outreach program. We've invited several organizations, as you know, and they are one of the organizations going to present this afternoon. Mr. Lebogang, you do know that you have 20 minutes to present your presentation, and then we are going to take another presentation after yours, and so you'll have time to prepare yourself for the questions. And members, the questions will continue after the presentations in similar fashion as we always do it. 3 minutes per party, whether you're going to take them by yourself or 2 or 3 members from your party will take that question. So I'll hand over to Mr. Lebogang. Do you want to continue, sir? Thank you. You have 20 minutes starting now.
Thank you very much, Chair. Thank you very much, honourable members of the Western Cape Parliament. It is an honour for us to be able to make a presentation on behalf of ISASA. As what people don't know is that obviously there are around 13 million students, and this is basically comes out of what we call school realities, which is published by the National Department of Education. Independent schools only make up, learners, sorry, may only make up 4.8% of all learners in the country. And what we do see in terms of how we view education between fee-paying schools and not fee-paying schools. So what we do say that is what Professor Nick Spall of the Stellenbosch University says, that really there is no difference in many ways between fee-paying schools, those are 1621 schools in terms of the South African Schools Act, and independent schools. And we actually do see that public schools where fees are paid achieve very similar outcomes that those of independent schools. We as ISASA are the largest and most representative independent schools association in Southern Africa, and we are made up of 851 schools on total, of which 793 are in South Africa. We are out of the total, Chair, in terms of the Western Cape. There is a total number of 1,718 independent schools. Total schools of 1,718 in the Western Cape, 273 are independent schools, and of those, 127 are our members. The Western Cape is the third largest association, a region in our association. The largest obviously would be Gauteng, followed by KwaZulu-Natal, and then the Western Cape is the third. Chair, as I've indicated, we are the largest school association in Southern Africa, and we have 15,000 educators teaching around 200,000 learners. Our fee range from no fee school
For example, there's Crystal House School in the Western Cape, where fees are not charged, to schools that charge higher fees. So we have a very, very big range in our membership. And some of our low fee schools actually charge fees that are lower than those charged by public schools. What distinguishes ISASA as a membership organization is a quality assurance that we undertake in terms of all our schools. If you do not meet our quality standards, you are unable to join us as an association. And every 6 years, every one of our members has to go through a quality assurance process to ensure that they are meeting quality standards. Chair, COVID-19 has really shown a significant change in terms of education in the world. What is clear now is that what we're going to do is that there is no question that hybrid educational method is now the new way in which education is going to be delivered. So that is something that we certainly know, that remote and contact learning is here to stay. What I think was also interesting that we as an association, in March, I had a meeting with similar organizations from the United States, Canada, England, and Scotland. And really what was clear is the regulatory uncertainty that COVID-19 has brought into education. And also what we have seen is that the role of teachers' unions around the world has been somewhat contentious. I got the opportunity to see an interview from the Minister of Education in Denmark. There, she talks about the strong social compact between parent associations, teacher associations, and the government. And she talks about that really has been what has enabled Denmark to be able to open up schools and have some kind of success in the delivery of education through COVID-19. But certainly we have seen our government and the teacher unions not on the same path regarding how they would respond to the COVID-19 pandemic, but it's very similar to what we see out of the United States and in England. But really what has been the advantage for independent schools is that we've been able to move to remote learning very quickly. Once the president declared a national state of disaster, we were able to tell our members, and was very much focused on how do you continue to be able to deliver education remotely. All our schools have been able to do so, from our no fee and low fee schools to our higher fee schools, to our highest fee schools as well. And there, what people used was, other than using platforms such as we're using now, Google Classrooms, Microsoft Teams, but for our low fee schools, we saw them using SMS and also WhatsApp in the delivery of lessons for their pupils. And some of our low fee schools also had to do food packages and use the delivery of food packages as an opportunity to deliver materials for students to learn. And the feedback really from our members has been very clear. They have not lost any school days due to COVID-19. But really, because of that, Chair, it was really called upon us as ISASA to how can we assist the country as a whole during this time. So we opened up a COVID-19 portal, which is an open access materials that enable people who need to access learning to be able to do so. So we do understand the limitations of that, obviously, and I think this is what I'm going to talk about later on. You need a device, you need connectivity, and you also have to have data. So, but however, we have been able to put in curricula, and our COVID-19 portal is really up and running, and anybody can access it, and really is there as a national resource for those who do not, for example, now that some public schools are closed, they could maybe find materials that they can use to continue learning during the break. So really what we have, and today is very much part of what we have tried to do, we really have been able and really appreciate the invitation to present to you as a provincial provincial parliamentary body. But we have really wanted to do our advocacy and inform people of what we do as a sector and how we engage and as public bodies for the general good. So we really have made sure that in our advocacy that we must remain constructive with the Departments of Basic Education. We have a very strong relationship with the Provincial Department of Education in the Western Cape, and we are deeply grateful for all that they have done. But our Minister of Education has shown great support for independent schools, and we've built that relationship over many years. We were honored to have our minister at our conference in 2018, which is our combined conference, which is our largest conference that we hold. But I think that we are consistent, and the minister has been consistent in her relationship, that a child in independent schools is a child in a South African school. So our success is a success for our nation. We also wrote a letter to the president in terms of early childhood development. ISASA was not involved in the litigation for the opening of pre-primary schools. However, we supported that these pre-primary schools be open. As we know, from conception to from conception to 6 years old is the most important time in a child's life and what will determine their life chances. So we really did support that that pre-primary schools should open. We were grateful that the minister did not appeal the decision that was adverse to the National Department of Social Development. And we also emphasize and are pleased that President Cyril Ramaphosa is going to be moving pre-primary education out of social development to education. We strongly believe that it is important that children be taught to become school ready so that we can have successes. Often we in South Africa are obsessed with matric results, but as we indicate as educators, if you want to improve the matric results, improve pre-primary education. So we really had a time in which the regulatory regime was quite uncertain, Chair. So at one time, the directions came out of the National Department that independent schools, if they wanted to bring in more grades than those set out in the schedule in the National Department directions, they needed to get consent from the Provincial Education Department and the HOD. I really want to thank the Western Cape Education Department, Chair. They were extraordinary. They gave those consents very quickly, and you must be very proud of the Department of Education in the Western Cape. Another department that was quite strong as well was the Gauteng Department of Education. However, we engaged with the minister and said, we really do believe that we should be able to give notification rather than get permission. And we're glad that she consented to that and revised the regulations accordingly. And that we're glad that now all schools in South Africa can re-enroll pupils as and when they've deemed fit, rather than have to follow the National Department schedule. If they give notification, indicate that they comply with standard operating procedures under COVID-19, and that obviously that the department can, either the Department of Health or the Department of Education can inspect and verify that they are compliant. So that is what we have managed to do in terms of the regulatory environment, of engaging the national minister to make sure that all schools had that freedom, and we're glad that she did so. We as ISASA had to do many memoranda on COVID-19. We came up on a regular basis with frequently asked questions with the notion of WhatsApp, Instagram, Facebook, and other platforms. There's a lot of misinformation out there, and we needed to make sure that we inform our members of what is actually information that is can be verified and is strong and can be relied upon. So, but also what we have worked on, and I really am pleading to you as members of the Western Cape Provincial Parliament, is that data is a serious matter, as I indicated earlier. We have been able to approach both Vodacom and MTN and get negotiated prices that reduce data rates. But what really is important, Chair, is that we need for all schools and all pupils to be able to access data at a reasonable rate. Part of what I managed to do was also to talk to some of our Indian counterparts And in India, Chair, all children were able to go to remote learning because data is affordable for both public and independent school pupils in India, even though India has a huge number of children in independent schools. So really, we're grateful to these service providers, but it really is important that this pricing and those concessions on price in terms of data must continue and should go on and hopefully expand to all learners in our country. What I do think that what we did do in terms of our schools was to really help them navigate what happened with COVID-19. Chair, the first COVID-19 cases that were identified in KwaZulu-Natal came, that father was a parent at one of our schools. So we had to learn very, very quickly on how we assist independent schools in terms of what they're going to do in terms of COVID-19. Remoteness is now the new role. We had to had to move our conferences to remote learning. We maintained many instances on online meetings with our members, including those in our Western Cape. And the head of our association for heads is actually the headmistress of the primary school at Herschel, which is a Western Cape school. So we've also looked at wellness for school principals, and this has been a very big issue, Chair, that they found themselves under really great duress due to the uncertainties that this has brought on. So we've also now developed workshops for our membership in terms of COVID-19, and really also during this time, what has come up is that obviously as employers, they needed to know what the new regulations are. So we are now informing them about what they needed to do in terms of keeping their schools and their employees healthy and hopefully not transmit the virus onto their premises, but also what are the obligations under human resources. Many of our schools, including those in the Western Cape, have had to cut salaries or freeze salaries in order to keep people employed. Regrettably, some of our pre-primary schools in the Western Cape had to close down due to COVID-19 and parents not being able to pay fees. The other thing that happened is that many of our schools have now, of our old girls and old boys, have indicated instances of discrimination that they had to endure in our schools. And this happened not only in the Western Cape, but around the country. We're also seeing this happening around the world. And we now are talking about anti-discrimination and helping our schools to understand their constitutional obligations of care in terms of the Constitution. ISASA Chair has been at the forefront in the media of informing the public of what COVID-19 means for schools. In fact, earlier on, I was also just been approached. I will be interviewing again on the SABC regarding what has COVID-19 meant for independent schools. So really, that is what has kept us very, very busy. And what we've been trying to do, Chair, is to calm people down, to tell them that if we have social distancing and the right protocols in place, schooling can continue. So that is really something that we have found that we've needed to inform people quite rigorously. The other issue, though, is that we are now understanding a lot more about transmission around children. And I think that as your Honourable Minister of Health in the Western Cape has indicated, due to youth, that is something that is an advantage. Yes, children do get the virus, but they do not get the same kind of symptoms unless they've got comorbidities. But as we know with COVID-19, you can really never know, Chair, who will actually succumb to it. And that is what makes it so difficult to plan accordingly. But Chair, as you indicated, I will take questions as you deem fit. Diabo Nkosi, thank you and bye danki.
Thank you, Sir Nkosi. Bye danki. Thank you very much, Mr. Lebogang Wanchane. We're going to take the next presentation so you can prepare yourself for the question. Doctor, are you going to put your presentation on the screen?
No, they're going to put it on for me. So
okay.
Come up and they're going to, there we go. That's the second slide. Go back to the first slide.
Zaida, can you go back to the first slide, please?
First of all, thank you very much for inviting us to.
Just hang on a second, Dr. Venter. Let she just make sure the presentation's on the screen. There you are. Excellent, Dr. Venter. You've got 20 minutes starting now. You can continue.
Right. Thank you very much. Thank you for inviting the Governing Body Foundation to be part of this today. I'm speaking on behalf of the Western Cape chapter of the Governing Body Foundation, which is a national organization. Our focus is on governance. You'll see it, our slogan is your thought leading cooperative school governance. So that is our focus, this narrower focus that we just heard from ISASA. And to go to the next slide, there are 2 points I want to focus on today. Second slide. First of all, what have been the governance issues or problems facing our schools during the pandemic? And then secondly, which is the question we were asked to present today, how the GBF has assisted its member schools during this period. The next slide will show you a kind of general picture of what people have experienced. We've had lockdown, but our schools and our staff personnel in schools have actually been on roller coasters despite the lockdown. Unfortunately, it's a corona roller coaster. Up and down and round about, and you never quite know where you are, getting very dizzy. They've even been to the circus despite the lockdown, but it's been, unfortunately, a corona circus with everything the way it's been going. So let me look at the problems. The next slide picks up a major issue, which ISASA has also referred to in passing, and that's the question of, let's see if we get that slide. Yes, information. If you just click down all the bullets, load all the bullets on that. Yeah, thank you. There's been huge uncertainty, lack of information at times. People don't know what's going on, or the information is late. I think it's appalling, absolutely appalling and disrespectful that sometimes on a Sunday night, schools, parents, and so on will be informed what's going to happen on a Monday. And then the changing information. And not only does it change, but people lose track of what is the latest. Are we on the right track? Do we know what we're supposed to be doing now as opposed to what we were doing yesterday? And then contradictory information. At one stage, the president declared that schools will go for a break, but there were documents floating around with the school calendar which contradicted that, and the directions, as they call them now, which said something different. And people over a weekend were looking at various possibilities of what could possibly be. So huge uncertainty as a result of lack of information or late information, changing information, contradictory information. So that's one big problem. Next slide, if you can also just put down all the bullets there. Yeah, thank you. Yeah. The governing bodies have found this very difficult because they haven't been at their schools, they haven't been allowed to go to their schools. And so you have people taking chances. Sometimes you've got principals saying, well, my governing body is somewhere else far away. Thank goodness I can do what I want to do now and run the show myself. Or sometimes the opposite has happened. And because governing bodies are remote and don't have to face the principal and the staff and other people at the school, they think they can just remotely run the show. The third option is where they have tried to work together, which of course is what we say you should do, hence our slogan, cooperative school governance. You should be working together. But when they try to do it, they can't always do it because how do you connect? The last point there is the issue of virtual meetings. People have asked, may we have virtual meetings? Our legal opinion is yes, even if it doesn't say so in your constitution, although it would be better, because the legal understanding is that if a term is not defined in a legal document, it means what it means generally, and today it means generally virtual or face-to-face meetings. So yes, they are legal, although some question that, but even those who accept it, you could do it, not everyone could connect. Some of the poorer schools, the SGB members just don't have connectivity or data And so that's been a huge nightmare for schools getting their SGBs to function as part of what happens in the school. Next slide, if you could bring all the bullets down, the financial aspects also hit our schools tremendously. You will be aware that fees have declined. People just can't afford it. I'll talk about it in a moment, but the income from fees has declined. And those that are not fee-paying schools have previously relied on fundraising to boost their income, and those, of course, couldn't occur. And then regarding the payment of fees, there are two problems there. First of all, the parents who say, I don't need to pay. Either my children weren't at school, or they go to school one day on, one day off, 1 week on, 1 week off, I don't have to pay. That, of course, has been a misunderstanding. There's a difference between a public school and an independent school. In an independent school, it is a contractual relationship to pay the fees. And so somebody could argue, well, I pay a fee for a service, I'm not getting the service, or I'm getting less service, I don't have to pay, or I must pay less. Whereas a public school is a contractual engagement, which means you have to pay those fees unless, of course, you are exempt. But some people have tried to argue with schools saying, I'm not going to pay because you're not providing what you're supposed to provide, which is incorrect. But besides those who argue that way, the others just can't pay now. They were paying, they were able to pay, they had exemptions, didn't have exemptions, and now they've lost jobs or lost income. And so schools have had to handle the two categories, those who just say, I'm not going to pay, even though I can afford to pay, and those who can't afford to pay. Huge nightmare for schools to handle all of that. And we've encouraged handling them sensitively and case by case. The lack of payment and the reduced income has had an impact on staffing. Those schools that employ additional staff, they've either had to retrench them. And you know, our people in schools are not legal people. They're not labor lawyers to know how to do retrenchment properly, which is fair, and which doesn't result that you end up with the CCMA, is a difficult thing for schools to do, or to reduce the salaries. There are technical, financial aspects, but there are also emotional aspects. These are your staff that you're having to deal with, which causes huge emotional problems in the schools. And then, of course, they could apply for the TERS UIF benefits, but anybody who's tried to do that will tell you it's a nightmare. You try to phone, you email, and you get no responses. Some schools have got their payments, but some haven't, and some have struggled, and we've just said, well, go on trying and trying. So that's one big headache, the financial aspects of COVID on schools. And then those are the problems. The next slide moves from what are the problems? The problems I've mentioned there of lack of information or SGBs, not being able to organize themselves, finances. How have we helped? The first one is we've been engaging with the DBE and the WCED, where we've had numerous meetings, especially at national level, sometimes even well into towards midnight. Regular meetings with our own HOD here, where we provided inputs. I see it's spelled wrongly there, inputs, and provided feedback, which we hope has influenced things and brought to the attention of the authorities what's actually happening in the schools. Our approach there has been a plea for flexibility to avoid the one-size-fits-all situation. We realize that different schools have different challenges, but our approach has been, if the school is able to open and meet all the COVID requirements, allow them to open. If there's a problem, then of course the school must not open, but at the same time, the department must make sure that they do what is their job to ensure that those schools are ready to open and to open safely. That's engaging with the education departments. Of course, we've been engaging with our schools, with our member schools. We've been extremely busy, those of us who work in the province with us, for the member schools, supplying information in different ways, personal interactions. I just counted up the days since mid-March. I personally have handled 311 individual interactions with individual schools, and some of them very difficult. They're not always straightforward answers, and sometimes actually it's just, as I'll point at the moment, providing more support than answers, but information we supply by personal interactions, email or phone call. Our website, we've added additional material there. And then communications, newsletters, email messages. We've sent out 33 national newsletters since March, trying to fill in the gaps, try to clarify things to people, to give them information. Next slide. We've gone beyond information. That's one thing people want. What is the correct information? What is the latest information? But that's not all that people want. People want to be encouraged. So we've had to encourage people. We've had to provide personal moral support sometimes to SGB chairs, to principals who are feeling absolutely smothered with over information or lack of information, providing a listening ear at times, and promoting hope. That picture I put up, I sent out one time, which says that I have very high expectations for all of you. When Shakespeare was quarantined because of the plague, which actually killed half of Europe's population, he wrote King Lear. Now, some people who had to study Shakespeare at school might say, what a pity. But for those who appreciate Shakespeare, it was great that he was able to do that while he was under quarantine. And we said to our schools, well, let's see what you can do while you are under quarantine. And I've been so impressed with the way schools have, in fact, responded to that. Next slide. Our support system, we don't just do it on our own. We've got our team of people who do this and so on. But we also draw on, in the next slide, please. Right. Yeah, thank you. Next slide. We draw on the WCED officials. And I must say that I've been extremely impressed with the WCED head office in particular. Let's go back to the previous slide, please. Go up one slide. Can we just go up to the previous slide? Okay, I'll talk anyway. We draw on WCED officials. There we are, thank you. And I must say that sometimes they reply immediately. The head of department will respond even after 10 o'clock at night if you send him a query. So they've been extremely helpful where we don't know the answers and we turn to them. We've used a very efficient labor lawyer who answers the questions about retrenchment and all that sort of thing. We have a litigation attorney because people get threatened by lawyers, by parents at times, and industrial psychologists, and we also draw on our own experience and our own training. So we have a broad support system for us to be able to support our schools. But the next slide gives you some idea of how our schools have appreciated what we've been doing. Just some of the comments we've received there. Thank you for keeping us well informed. That came over and over and over. They say we're a backstop for them. And then I talked a moment ago, it's not just information. Someone said, thank you for humanity and support to overcome our anxiety, especially when you've got different departments saying different things and so on. So we have had a lot of feedback saying that they appreciate what we've been doing for them. And then the next slide, I want to say, I've already hinted at it, but I want to say well done to the WCED. I know not everybody agrees with the WCED's stance on things and the HOD's stance on things. And of course, there will always be differences, even amongst some of our own member schools. There have been some differences, whether they feel that he's on the right track or not, or the department on the right track or not. But no one can deny that they have provided clear and timeless information and been filling in the gaps. Sometimes, almost on the spot, when something has changed or the people don't quite know, we get a letter from the head of department along with all sorts of other information to our schools. And taking a stand and showing leadership. And when people feel, we quite frankly don't know where we're supposed to be going, what we're supposed to be doing, it's all just so vague or unclear or contradictory. Our head of department has taken a stand, and working with the MEC, the minister, I think actually they do deserve a thumbs up and a well done. And then lastly, the last slide here, well done also, I've hinted at this to our schools. The next slide can come up, please. Well done to our schools who, despite everything, haven't given up. They've just got on with it. They felt there's no perfect hour. I've had secretaries, I've had principals, I've had SGB chairs saying, yes, it's difficult, yes, it's awful, it's absolutely awful, it's unprecedented, but you can't just give in. That we are there for our children, we are there for our school community, and we must go on doing it. And not just go on doing it, but as Isasa has hinted at as well, seeing new possibilities. Let's reinvent things. Let's do things differently. In fact, some of them saying we're going to emerge even stronger and better from this COVID period. And then the last slide just says, thank you for listening. And I hope that what I've said gives you some idea of what the GBF has been doing to support schools in the Western Cape. Thank you.
Thank you, Dr. Fenter. Much appreciated. Thank you for your time. Mr. Kenny Williams. Mr. Williams, you were on earlier on. I presume you're still here. Mr. Kenny Williams.
Yes, thank you, Chairperson. Yes, I'm here.
You can continue, sir. Just in your name and the organization you represent, and then you can continue. Thank you.
Thank you, Chairperson. Thank you for the opportunity. I'm from the Wellington and District Governing Body Association. And I think the question that you asked was the challenges that we are facing and then some of the things that we are doing here in the area. Now, Chairperson, for starters, the one thing that we are struggling with is especially the SGB post. We are in a position at our schools that we don't have the funding anymore to keep on with the SGB post, which means that we are actually forced to get rid of the SGB post, and that puts a lot of pressure on SGBs because during the lockdown, schools were not able to do fundraising, which is our biggest income. To pay the salaries of the SGB post. So that is and it's going to be for a long time one of the challenges, especially in the working class schools, a challenge for us. Then, Chairperson and committee members, the biggest challenge that we are facing is the return of the grades on the 24th of August. In some of our schools, we have the challenge of overcrowded classes. We have the challenge of not enough space, which is dictated by social distancing. And that is the challenging that we are facing. And we will have an emergency meeting on Sunday to discuss some of the issues and how we can support schools around this. Chairperson, again, the whole thing on ECD, I think it was raised earlier by Sasa. We are facing the same problem with the ECD sector. Then I think one of the challenges and the biggest challenges that we are also facing is the absenteeism of our learners. We are hovering between 65 to 90% of learners in the grade 12 and 7 that is not at school yet, and that is problematic for us as a SGB organization, because we cannot accept the fact that our learners is not returning in the manner that they're supposed to return to the schools. But it is work in progress from our side. Chairperson, and then the next thing that is also very challenging for us is the whole thing about comorbidities. Now, we have the challenge that by now some of our educators didn't receive a response from WCED around their status. So that is the challenge in terms of the planning then for not the senior management but also the SGBs on how to deal with this. So that is just one of the challenges that we are struggling with. Then the next challenge is also the whole thing about replacements. We come to the conclusion, and I spoke to some of the chairpersons early in the week, that there is a problem of not enough replacements, people that is not qualified to assist schools at the moment. Chairperson, and then another thing is the resources. We are so much under pressure when it comes to our resources, the limited resources that we have at the moment already. When it comes to, you need to remember that at the moment some of the schools are using extra photocopy paper as an example. So the system is under pressure, under huge pressure. Remember, I referred earlier to the fact that we are not in a position to do fundraising at the moment, and that is really a challenge for us as working class schools. So that is the one thing that we are really struggling with is the resources, and that will be one of the agenda points in our meeting. But Chairperson, as a solution, or a probable solution was that we established a month ago Education Crisis Committee, which include also some of the PAL schools, and they will also be part of this meeting. And what we are doing at the moment is that we try to support schools to distribute some of the materials while some of the learners is still at home. So we bring back the old thing about street committees, and in some cases there is successes around it in assisting the schools. We also tried, and we are quite hard and busy with, to recruit retired teachers to come and assist us in the system because of the pressure that we are under at the moment. And then, Chairperson, again, for the working class schools, we have the problem of resource sharing. Now, at our more leafy schools, because of a lack of a better word now, that's the one thing that we are struggling. That some of the more resource schools, in many ways, is not able to share some of their resources, and that is something that I think that we need to look at. That your more affluent schools should look at at the resource sharing. And then, Chairperson, with the recruiting of the retired teachers in the Education Crisis Committee that we established, we are focusing at the moment on the matrics and to see how much we can support the matrics over weekends and also after school. So in short, Chairperson, that is what we are trying to do at the moment. Not much at the moment, but that is from our side as a Wellington SGB. We try to assist the system, but also to make sure that we are working through the crisis that we are currently finding ourselves in. Yeah, I think I covered most of what I was supposed to cover. But thank you, Chairperson, for the opportunity to make an input. Thank you.
Thank you, Mr. Williams, and thank you for your time for coming up to share some of your thoughts this afternoon. I would appreciate if you can deposit some of the information that you talked about with this committee, and I know that you say also meeting on Sunday. If after your meeting you can just via our coordinator that made contact with you, just share that information and some of those ideas and suggestions with this committee, please, I would appreciate it. This Parliament is known for liking ideas. We like new ideas and we enjoy new ideas, so please do that. Members, just before we continue with the question, just for the record, because I do know that question might come up, we have invited many other SGBs in the Metro, so we do appreciate it to those individuals that has come and shared some of the challenges and their concerns with the committee. We invited the Kalija organization, the Mitchells Plain SGBA, the PAL SGBA, and several other SGBAs, and those information is with the coordinators if members of this the committee wants to see the list, and the ones representing it this afternoon are those that have responded and that have obviously presented here. I'm going to start like we normally do it, hand over for questioning. We're going to start with the DA, and they're 3 minutes. And if you can please ask your questions to all three representatives here this afternoon, I would appreciate that. 3 minutes with the DA.
Good afternoon, Chair, and thank you very much for the comprehensive presentations from ISASA, GBF, and FETSAS. Member Bosman and I will share. I just want to check with ISASA. Well, you made the example of Crystal House. I want to know how well are you spread in rural Western Cape with regards...
Ms. Botha?
Yes, yes.
I do apologize, complete oversight on my side. Please accept my apologies. Fedasa needs to represent as well. I do apologize, sorry, I just missed them on my list, is my mistake. You can continue, sir. Sorry, Ms. Botha, my mistake. You can put on your mic.
This is Tony Marshall.
Yes, Mr. Marshall. Yes, I've actually got a note here that I must ask you to switch on your camera.
Beg your pardon. I'm from FETSAS, and I wonder whether, first of all, I can say thank you very much for the opportunity, but may I, from this side, share my screen?
Yes, please do so. Please do so.
Are you able to see that, sir?
Not yet.
Let me try again. Beg your pardon, sir.
No problem.
For the time taken. I hope you can see this.
Not yet. Perhaps try again. I can see something moving.
I beg your pardon, sir. Let me try again.
Chairperson, through you, we can share it from our side. We have the presentation, and then Mr. Marshall can just take us through that.
Well, thank you very much.
Sorry, Mr. Marshall. Okay, Mr. Williams, can you switch off your mic, please?
Thank you very much. Chairperson, may I say thank you very much for this opportunity, but also let me sing the praises of Ms. Kluti, who has been absolutely wonderful in facilitating this. Are you there, ma'am?
Yes,
Mr. Marshall. Thank you, Marshall.
Thank you very much. So we're the Federation of Governing Bodies of South Africa, South African Schools, FEDSAS. And the next slide, please, ma'am.
Okay, we're going to the next slide.
Thank you. Yes, so who are we? We're a national NPO with head offices in Bloemfontein. We have, and this is quite important, we have 550 member schools in the Western Cape, more than around 60% of which are in quintile 1, 2, and 3. And our sole purpose is facilitating management and governance according to law and policy, and including, of course, the King 4 principles. Thank you very much, ma'am. Next one, please, ma'am. Thank you. So the most important thing about FEDSAS is that we try to instill and promote the culture of excellence in teaching, education, and service delivery. And so, to be frank, we've felt a little out of kilter with some of our education partners, and I'm thinking now of some of the unions, and in fact, at one point, all of the unions, in terms of getting our learners back to school. We've based our position, our policy position, in fact, on the latest and most wide-ranging medical information regarding youngsters. We've also obviously taken into consideration that the statutory obligation of paying school fees has not been fully understood by our parents. Consequently, those who can pay have not necessarily paid because they have not understood that it's a statutory obligation like a tax. The no-fee schools, again, have been in trouble because they can't obviously do, I beg your pardon, fundraising. And that has been very, very difficult then to serve the best interests of our learners. If I may say so, it is heartbreaking to think that our grade 5s and our grade 8s have been out of school since mid-18 March. And those youngsters we are very concerned about. And so one of our policies has been to try to get our schools and our SGBs to open up as soon as they possibly can. And for that reason, we've been very, very grateful to WCED, who has been, frankly, at the forefront of supplying PPEs and various other support mechanisms for our schools. Let me say that we regularly meet with the WCED, as do the other SGBAs, and also with other NPOs and NGOs. And in that connection, let me say that I honestly believe that it is the lattice work of light from NGOs and NPOs in the education sector that have really tried to keep our communities together. And in that connection, let me say, the marvelous, marvelous work of NPOs and NGOs in feeding schemes for our hungry children. Next slide, please, ma'am. Thank you very much. So we have a full-time education law desk, and that has meant that we were able to advise SGBs, not only the SGBs that are members of ours, but through webinars, through Zoom interaction with anybody, free to the public, free to members of some of the NGOs and NPOs, information on how to save jobs, how best to save jobs. You know, there are various ways in which one can, by shortening the staff members' work hours, by putting them, in fact, on some kind of leave, and so on and so on. So our law desk has been absolutely brilliant as specialists in helping our schools as far as that's concerned. We've had around 50 national and provincial Zoom webinars with our schools and obviously with the public. We do everything in our power, sir, to empower our staff members, and that includes me. And in the Western Cape, as I say, we have 550 schools, and there's 7 of us who serve those schools. Now, the vast majority of us working for FEDSAS in the Western Cape are past principals, and obviously some people who, like our chief in charge, Mr. Henry Botha, was a district director. And I apologize for his not being here this afternoon. He, in fact, is busy with a webinar with our members and members of the public around anxiety and emotional support for members at schools, not only the teachers, but also particularly the youngsters. They love to get back to school, but once they're there, they are thinking of the people at home who have comorbidities. So just to repeat then, our 550 members in all quintiles, more than half of whom, around 60% of whom, are no-fee schools, and this amounts to more than 1 in 3 schools in the Western Cape. And we're very proud of that, and there's no way that we will ever turn someone who applies to membership at FEDSAS away because they can't pay. And in that regard, let me sing the praises of the Education Department, who has a tiered process of sponsoring membership of governing body organizations. So the quintiles, the lower quintiles, get the equivalent of norms and standards. The higher quintiles get the equivalent of their norms and standards. So in quintile 5 school will get, for example, 508 Rand towards their membership subscription, whereas quintiles 1, 2, and 3, for example, and some of the 4s will get as much as 2,400 Rand. Next slide, please, ma'am. Thank you. Thank you very much. Let's be honest that the COVID-19 activities are a new reality. People talk about a new normal, and I think that's just being, frankly, nostalgic. They want to go back to what was, and I don't think we're ever going to go to what was. Let's talk about information gathering. The FEDSAS really does its level best to find reliable, verifiable, and timeless and responsible and trustworthy information and spread that far and wide. We have newsletters for obvious reasons that we don't mind people duplicating and sending all over the place. Our changed modes of interaction have been on national and provincial webinars that I've mentioned, on radio, on all the radio stations, but particularly in the Western Cape, the Voice of the Cape. I've been personally on it twice, talking about trying to preserve jobs, and then secondly, the I think rather fraught issue of online learning, and we'll talk about that in a little while. So our Zoom tailored sessions have been clearly to train up SGBs. We've got to be careful though that the SGBs need to be trained at a distance, and that then, unfortunately, as one of our previous speakers has spoken, quite expensive. If you think that a Zoom session of an hour is going to cost the equivalent of a gigabyte of data. Next one, please, ma'am. Thank you very much. We want to sing the praises of the WCED with their guidelines. They've had guidelines A down to S. Each one of them has dealt discreetly and incisively with each one of the elements, and I think it really has been remarkably useful. We've had obviously some people complaining because they come in waves on a Sunday night, as someone mentioned, but certainly the school principals and the school governing bodies, and more importantly, that very important COVID-19 committee that the WCED asked schools to establish, which includes an SGB member, has to include an SGB member, has so empowered our members, in fact, all our schools, with exactly the kind of verifiable how-to of steps to take. Now, we have obviously mediated some of that to some of our schools. We have been a little concerned that most of those guidelines have been in English, and that obviously is a hurdle to certainly some of our members, and I suspect to other schools as well. that the Afrikaans and the isiXhosa versions have been a little slow in coming, but that they have come. We once again want to say that's wonderful. We also want to really say that the feeding scheme, apart from the feeding schemes that some of our NGO and NPO, beg your pardon, collaborators have done, we really think that the feeding scheme has been marvelous. But I know personally, I was at Red River Primary School the other day, where the feeding scheme could not continue because of the danger in the area. And we have mentioned this to the head of education, and certainly we want to mention it here, that unless our schools are adopted as safe havens by our communities, unfortunately, our youngsters are going to go hungry and our people are going to go hungry. And we want to try to prevent that with every possible fibre that we can. And if you can help as far as that's concerned, Parliament, Western Cape Parliament, that would be absolutely marvellous. I said I'd refer again to the online and distance learning. The operative word at the moment is an autodidact. In other words, a youngster who learns virtually on his or her own. To be honest, many of our parents have struggled to help the youngsters. And of course, there were memes in the early stages of lockdown that made a lot of fun of parents saying, thank heavens for teachers. And I want to say once again that I don't think FETSAS has ever been as proud to be a teacher organization, a teacher organized organization as well, in terms of people like myself and my colleagues, but that we have been so proud of the agility, the innovation, the creativity, and the sheer resilience of the South African. You know, what we were talking about in FETSAS was that the RSA is resilient South Africans, and we're very, very grateful for that, because we don't know how long this lockdown is going to take, and we don't know when inoculations are going to be possible, but we do know that we've got to make a go of it, and our youngsters will be okay. I also want to say that we are so grateful that the WCED understood that data is a problem. Autodidacts are few and far between. And so I differ a little bit from our experience with our membership regarding online learning and distance learning. So we are incredibly grateful that the WCED has a memorandum of understanding with our members, with all the schools, for printing, and has given them an enormous printing budget, so that when the youngsters fetch the food, for instance, they at the same time get work that they can take home and then deliver completed a couple of days later. And that, I think, has been genius, and I think it's virtually unique in South Africa. And it's really something to be proud of. And you as a parliament, I think, need to be thanked for that, because obviously you sit with the purse strings for that kind of thing. We also want to say, with some of our colleagues a little earlier, about the SGB staff. You know, the statement is that school fee payments fell off a cliff. There's no question about it. It fell off a cliff. And along with that, unfortunately, and here we want to take some responsibility, but also we want to ask the governing, the WCED to do more training with the people who aren't members of governing body organizations, who did not know how to fairly look after our SGB employees. By fairly, I mean that there's a process of negotiation, there's a process of consultation. You don't just fire people, as unfortunately, from my calls on Voice of the Cape, I heard that there were unfortunately governing bodies and schools that simply fired people. Now, the CCMA is going to be, I think, deluged by people, because we've got to understand that a significant proportion, and I'm afraid I don't have the figures with me at the moment, but around 20% of teachers, and it may be vastly more, I remember 20%, and I don't want to exaggerate, 20% of teachers are SGB teachers, so 1 in 5 teachers, if they have been badly treated, are going to end up at CCMA, and that's going to cause havoc in the education sector. Lastly, let me say then on this slide that the TERS and UIF has been good, but it's dwindled. The last payments were sometime in April, May, and we're still worrying about June, July, and obviously August coming up. Fake news and anxiety has been enormous. And so, as I say, Henry Botha today is part of a team who are dealing with the anxiety that our schools are feeling. And there is no easy answer. Next slide, please, ma'am. Ms. Kluti, thank you very much. So what can you do? Our appeal is to help us to help you by giving trustworthy, sensible information and behavior. What I mean by that is that it's unfortunate that parents have been, I think, misinformed and have tried to shut down schools. I don't think that has been fair to either the principal or the management team or the SGB. I really think that that is something that needs to be addressed in our province. And FETSAS also feels that the number of youngsters who are not going to schools need to be encouraged to go to school, because we can't end up with them finding other things that may be more attractive. We also are appealing about the ECD sector. Some of my colleagues have mentioned that. It's absolutely, absolutely critical that Department of Social Development really get its act together at all levels to make sure that those don't close down, because we have information saying that around 50% of ECD sector centers are closing down or have already closed down or have given notice that they're closing down at the end of the year. We also ask that you retain the moral high ground and support everybody who retains the moral high ground for the best interests of our learners. It's absolutely wonderful that NSFAS has opened up its portals already for youngsters to study. But more importantly, far more importantly, is we've got to develop job opportunities for our youth, because we can't put people into the NSFAS hold-all that takes them to universities or to TVET colleges, and then in fact only delays the unemployment. We've got to get jobs working, please, please, please. And I do want to thank, again, the WCE, not the WCE, but your parliament and the people working in parliament who are really trying to make jobs available and try to attract investors to the Western Cape. We really do need that. And thank you very, very much for that. I don't know whether it's even reasonable to ask, but if one doesn't ask, one isn't going to get an answer. The SGB staff, now, when we spoke to WCED, they mentioned that as far as possible, they were going to try to maintain the staff establishment. In other words, the number of staff members at schools, despite the wavering numbers in our schools. And we really ask you, if you can, to increase the number of teachers, to compensate for the SGB staff that are going to leave. We have to be pro-poor, there's no question about that. Those who can afford, do afford. But let's also be honest, I think a lot of those who could afford in the past are no longer going to afford. Chairperson, if we can go to the next slide, then allow me to say thank you very much once again for the opportunity. I'm representing FETSAS. I'm very grateful to represent FETSAS. And I do want to say thank you very much for this opportunity and to everything that the Western Cape is doing. I think we can all be profoundly grateful for people like yourselves doing their very, very best for everybody in our neck of the woods, in our little part of the world. It's difficult, I know, but thank you very much also from FETSAS. Thank you, sir. And thank you also again to Ms. Kluti for running my slideshow for me. Much appreciated, ma'am.
Thank you, Mr. Marshall. And again, please accept my apologies for earlier on. We nearly missed you there. Thank you very much. And thank you for the presentation. You are indeed the last person. We're going handing over to the members, and we had Member Lorraine Botha on the floor. Thank you, Member Botha, for your indulgence. Your 3 minutes starts now.
Thank you very much, Chairperson. My questions is posed to ISASA. I just want to check, have you lost revenue during this lockdown period in regard to no fee payment? And how have you accommodated those parents who could not continue paying school fees or requested a break in payment? And then how many teachers are teaching from home per se because of comorbidities? And how many applications have you had for sick leave due to comorbidities or COVID? And you talk about wellness meeting for school principals. I just want to check with you, how have you assisted the fears of teachers? Or yes, how have you assured the fears of teachers were allayed as well? Thank you very much, Chair. Member Bosman will continue.
Thank you, Member Bosman.
Thank you very much, Chairperson. I just wanted to ask the Governing Body Foundation if they could perhaps tell us what role the learners are playing in terms of having a learner voice in the Governing Body Association, because they legally are supposed to be involved in the Governing Council. And then I wanted to ask what percentage of members have been asking for and accessing psychosocial support during this time, and if any psychosocial support is being provided by specifically the Independent Schools Association for teachers as well as for learners. Thank you, Chair.
Thank you. The DA still got 1 minute and 13 seconds left. Member van der Westhuizen. No. We can continue to the ANC.
Chair, I can ask Member van der Westhuizen's question. He did send it to me.
Okay, Member Bosman, you can continue.
Member van der Westhuizen would like to know the independent schools specifically, what the future of independent schools will be like under the hybrid model, as many independent schools distinguish themselves from public schools by their co-curricular activities such as hostel lives, the values and excellence in sports, etc. How do you achieve that kind of excellence online? So that would be for the Independent Schools Association, Chair.
Thank you, Member Bosman. To the ANC.
Thank you, Chair. My first set of questions is for the Independent School Association. It's relating to slide number 9. Can they tell us how will the deviation widen the inequalities in education? That's regarding slide number 9. Slide number 10. They speak about. I just wanted to know whether the interventions that they speak of on slide number 10. For which schools are these? Are these for all schools? How will these learners from disadvantaged families and from poor schools also benefit from these deals that they're speaking about? Then on the slide number 12, with regards to the workshops regarding discrimination, I wanted to know from them how many schools have been assisted and how does the organization assist with complaints and institutional with complaints around racism and around discrimination, especially in the former Model C schools, but also, just that thing. Then I wanted to know, let me just get to my next, am I still okay with time, Chair?
Yeah, you've got 1 minute and 40 seconds left.
Okay, I've got 1 minute and 40 seconds. Then with regards to FEDSAS, let me just get to FEDSAS. Okay. With regards to FEDSAS, on slide number 6, can they tell us more about this fake news that they're referring to? And also with regards to the feeding schemes, particularly the safety aspect, what support and advice was given to the WCED? Also, can they give us more details on the renegotiated staff contracts? How many posts were affected, and what is the way forward? Then my final question is to the GPF. Let me just get to them. My final one would be around relating to slide number 5. Tell us more about the disconnect that they talk about. What challenges did it present, and what matters basically were affected? Then on slide number 6, if they can expand on the info given on the slide, I'd like to also get a sense as to what was the impact of the retrenchment and the reduced salaries. How many people were affected? How many schools? How many TERS did they receive? And how many were approved? And then on slide number 7, what kind of assistance was received from both DBE and the WCED? And then on slide number 11, that's my final questions, if they can give us more details about the appreciation to WCED. Does it take into consideration also the times when we have found that communities had to take matters into their own hands for schools to be closed down for disinfection? Thank you.
Thank you. I see the EFF.
Thanks, Chairman. Yeah, mine is very short. The first one goes to ISASA on the issue of school fees increase during the COVID-19 period. That what can they advise us as far as that is concerned? Because there are schools that have increased. If I can make a typical example, observatory primary, there is a parent that consulted saying that there is a serious challenge of that they have experienced. And also the issue of buying of PPEs by parents, as well as data and the devices that have got to be utilized in independent schools. What can they advise us in terms of that, as far as if that is concerned? And then lastly, from ISASA, is that they have raised an issue about early childhood development, the letter that they've written to the president. Now, I want to understand in terms of what is the rationale behind them proposing that the pre-primary schools, they need to be moved from social development to basic education. And then under governing body foundation, I just need under the issue of uncertainties. They've raised a number of issues there in terms of disconnection and all that in terms of communication. I just wanted to know from whose side would they maybe advise that, how did that take place? And because it's one of the challenges that was experienced during the COVID-19, so that we would know what we can do going forward. And then on the issue of engaging with between DPA and the Western Cape Education Department, what I need to know is that what responses did the two government advise the governing body as far as to the issue of salaries and retrenchments that were faced by the governing body that they have raised? And then lastly, as far as to the issue of the clarity on the issue of training, they talk about the support systems that they've noted, that one of them is that was their experience and training. Now, I want to understand that, was it a general training that they normally undergo, or was it a training around issues of COVID-19 that they've managed to experience? Thank you very much, Chairman.
Thank you very much. Good.
Chair, I'm covered by the previous questions. Thank you.
Thank you. The ACDP, Mr. Christians.
Thank you, Chair. Just one question, and that is concerning the SGBs. And like the speaker said, you know, they were just fired and all of that. So we have schools that, you know, there's schools that have SGP posts, and a lot of those posts are now obsolete because of, as he said, the non-paying of school fees. So now you have, you know, schools that already have big numbers in classrooms, the ratio between teacher and learner. So now that is going to also now increase the ratio between teacher and learner. So I don't know, you know, what will be done with the SGB post, but I mean, the fact that people cannot pay, they cannot pay. And I think especially in the poor areas, the disadvantaged areas, the numbers of our learners is going to increase tremendously. So that is a concern. And I don't know if there's an answer to that, how we're going to get, the ratio between the learner and the teacher, less pupils in the class. So that is a big concern. I don't know if it's a question, it's just a comment. So that is a big concern because people cannot pay their school fees. We hope that over this time with the level lockdown 2, it will be better. So that's all that I want to say, Chair. Thank you very much.
Thank you, Member. Al-Jamar. Can I hand over to Member Freedom from Plus, Member Mrc.
Thank you so much. I would just like to know from ISASA, the consent for deviation from directions. Who gave that consent? And what was the nature of the deviations and the extent of the deviations from directions? And then you said that you managed to get a special price for data and devices from Vodacom and MTN. I wondered, where was Telkom? They should have been the first in the queue. They a public body. Why must the private sector come to the party, but not Telkom itself? I'd like to know, did you ask them for special prices, them and Cell C, or didn't you? And if not, why not? And then I would just also like to know that whether you feel that there has been enough public participation when it comes to contact with the Western Cape Education Department and the National Education Department. And I'd like to know from FETSAS, and I'd like to know also, because most of you have been falling over your feet to compliment the Western Cape Education Department. I had to close my ears at some time, but be it as it may, can ISASA tell me whether they are satisfied with the extent to which you have been consulted and your views have been obtained about the opening, closing of schools and PPEs, etc. Thank you.
Thank you. That was the final comments. We're going to answer the questions in the order the presentations were made. And if I can give each organization 4 minutes to respond at most. If you can finish it earlier, please do so. Mr. Majani, you can start.
Thank you, Honorable Chair. We'll ask where our schools are, and I'll be quite quick. We've got members in Knysna, George, Paarl, Hermanus, Gebel, Franschhoek, Marbury, Durbanville, Plettenberg Bay, Greyton, McGregor, Worcester, Somerset West, Friedendal, Atlantis, Stellenbosch, and Khayelitsha. Chair, in terms of when we're talking about fee payments, we really encourage all parents, if they had problems with fees and that they'd lost their jobs, to please contact their schools. Obviously, those parents that had paying fees prior to lockdown were seen would be treated differently to those who had been in arrears. So each school makes a determination in terms of payments and a loss of revenue. But obviously, schools really work hard and do discounts on an individual basis based on the needs of each family. And in terms of our teachers, one of the great advantages of our independent schools is that, as I've indicated, is that we have been able to continue with online learning. As a result, those teachers who have got comorbidities would not have gone back into schools. So they either are going to be assisting with marking or they're teaching remotely. Also, none of our schools have actually gone 100% back in terms of pupils and teachers. It is basically in order for us to honor social distancing, it is students come in every 2 days or every 3 days and with the combined. So we really are seeing very much in independent schools, the hybrid model. In terms of school wellness, ISASA is a schools association with two, what we say, constituent members of SEHISA, which are made up of heads, and BURSAs, which is the SEBISAs, which are made up of business managers. We obviously, unfortunately, don't really interact with teachers because of our structures, but each school has been charged, obviously, with trying to do psychosocial support. But we as ISASA need to do a lot more on that. And that is what we're working on it until, and then COVID-19 came along. In terms of our co-curricula, obviously only the T contact sports have been affected. Those, for example, in terms of music lessons and anything that can be done remotely have continued to do so. But I must emphasize that really that is an advantage, but many public schools have very wonderful and admirable co-curricular activities. So I think that I must add that. So obviously, I think that rugby, soccer, any kind of hockey or any of those field sports are now being done remotely. But our sports departments are continuing to keep with conditioning of their athletes on a remote basis. There is no question that I think that the divide has been opened up quite significantly. But I want to go back to Professor Nick Spall. We've seen that divide and the gap in South Africa between fee-paying and non-fee-paying schools. And as indicated by the other governing bodies associations, they have continued to work and do teaching. And Western Cape has done very well in terms of the food parcels and delivering learning. Cell phone data deals is we saw what happened with the universities, so we then approached those cell phone providers. And I really do appreciate the call from Honorable Mares in terms of Telkom. We are beginning our discussions with Telkom, and hopefully they'll do so. But I'm asking you, certainly as parliamentarians, that we really need as a country to make sure that these deals are available to all learners in our country, not only those who are in independent schools. In terms of discrimination, ISASA has worked very, very hard, Honorable Chair, in terms of educating members about inclusion. And now we have actually seen that our effort for inclusion has not necessarily worked. So, okay, thank you. So what we've had to do is that we have, as a result, had to do more on that. But Chair, one more thing that I just think is important, and then I'll leave right now. It really is important, and it's a passion of mine. School readiness is a problem in our country. That is what distinguishes children whose parents are educated and those who are middle class. So what is important about moving social development to education is that children need to be prepared for school readiness. That is why we do not do well in our education. Children are going to school not having gross motor skills, not knowing their primary colors, not being pre-numerate and pre-literate. And I encourage all of us to support our government's move to education. And I must say, the Western Cape Department is wonderful, supportive, always engages, and always available for meeting. Thank you,
sir.
Chair.
Thank you, sir. Dr. Venter.
Right, I've got a whole lot of questions here, and I'll try to answer them. I hope I've remembered all of them. There was one question about learners' roles in governing bodies. We don't have any kind of picture of this, but I suspect that they haven't been particularly involved. Governing bodies themselves haven't been as involved as they used to be, and schools differ to what extent they bring the learners in. But some of the learners might even be in grades and not back at school yet. So I suspect that they haven't been much involved. The disconnect in governing bodies, I don't have much more to say other than the fact that, I mean, even some of our better resource schools I know haven't had any physical meetings yet. So they've tried to work about decisions about opening of schools or not opening of schools. They've had to deal with things like appointments, learner discipline issues, all kinds of things, and they've actually been quite inventive and creative how they've managed to do it. Some of them are quite technical and difficult. Retrenchments of staff, I don't have numbers. I just know that there are schools where half the staff were retrenched. Some of them are on 70% salary, some are 50% salary. Someone will ask the question about what the implications for ratios. It's not good. And we know, in fact, we've heard that there won't be any more teachers next year, state employed teachers. So you're going to have no more state employed teachers for next year, more learners in the schools and fewer SGB teachers. The situation's not a very exciting one. Engagement with WC and DBE, let's say the DBE sometimes listens and sometimes doesn't listen, but they also are in a difficult position. They're caught between the unions, they're caught between government associations which don't always agree with each other, and other organizations and other partners and stakeholders. So obviously they can't just do what we want, but they do listen and they have taken things into account. The question about the WCED, I can only tell you that when I sit with meetings with my counterparts from the other provinces, it's chalk and cheese. In terms of engagement, in fact, while I'm engaged in a meeting with my counterparts in a Zoom meeting, I send a question to our head of department, and while I'm talking to these people, I'm getting an answer. And they just don't get that. They just don't have. It varies. Some provinces are better than others, but in terms of information provided, feedback, response, and response time, I'm not into praising the WCED for praising them as such. I don't take sides with anybody. I'm just talking from factual experience there. I think that those were all the questions. Thank you.
Was that all the questions, sir?
As far as I know, as far as I was able to scribble down, if I missed anybody, I don't know if you allow them to repeat the question, but
no problem. We can come back if there is. Mr.
Mr.
Williams,
Chair, Mr. Chair, I asked what deviations from directions were allowed, and that question wasn't answered.
Member Marais, I didn't want to interrupt you. We'll come back to all the other questions later on. Can we just continue with the rest of the answers, please, first? Member Williams, you can continue. Lizette, is Mr. Ken is still here?
Yes, Mr. K. Williams is here.
You can continue, or he's on mute.
Yeah, I'll just text him.
Mr. Williams, can you unmute yourself, please?
No, Chairperson, I don't think there was any questions posted at me. I'm not quite sure.
Well, I think there was more of a comment from Member Christian. I agree with you. It's fine, Mr. Williams. Can we continue with Mr. Marshall?
Okay, Chair.
Thank you, Chairperson. I'm going to try to take them in the order in which they came. And let's start with the idea of fake news. I think we all know that there were all sorts of news items, particularly on social media, regarding the opening or not opening, who was going to open, who wasn't going to open, had they opened, and so on. There are a lot of fake news that, as far as that's concerned. Then probably the most damaging was the fake news about medical information of, let's say, for instance, a colleague who happens to be a principal who did take ill with COVID-19 and then was rumored, and this was very damaging, rumored to have passed away. Marvelous resilience from people who then went back to their schools and currently are running their schools very, very well. Also, the extent to which comorbidities were involved. You know, everybody who was ostensibly as rotund as I am was given a death sentence. You know, you couldn't go near schools because the children were going to infect you and you were going to die. More than that, as far as medical information is concerned, the fact that if you happen to be diabetic, you were sure to die. That kind of stuff sent anxiety through the roof, and our governing bodies had to be very, very careful how they negotiated that particular area, particularly when the governing bodies wanted to open and they were told they may not open or they will not open. You know, we saw people going onto the grounds of schools when clearly they were not permitted to go onto the grounds of schools without a permit from from the principal. That was unfortunate, very unfortunate, because it created immense anxiety, and was most unfortunate as far as we were concerned, because very often the governing bodies were considering what is best for the school, along with the same issue about fake news. At what point must the school be sanitized? The delivery of the PPE, various elements. Was there enough? Wasn't there enough? Hadn't it arrived? Had it arrived? All of that created immense anxiety. And thank heavens, and I really say I'm proud to say that our principals and our schools and our SGBs handled it with aplomb. And so that when they eventually did open, and we encouraged schools to open, we were faced with the idea of, no, you may not open, no, you must open, and all of that kind of stuff. So I'm sure the members will be aware of it. Let me also say that we based all our information on Professor Shabir Mahdi and Professor Shaheen Mekhtar. Those were the medical and incredibly sensible, practical, calm people who said, we don't know enough, err on the side of caution. And when they did know enough, they said, well, try this, try this, try that. Very good. In terms of the training, we had to do a lot of training with governing bodies around governance and management. When you're on the SGB, you're a governor. You can't try to manage the school. So, for instance, you can't arrive at the school and say to the principal, but you must do this or you must do that in terms of the various temperature gauges, and you must spray so much, and you must fumigate, or you must have these tunnels that were eventually shown to be absolute nonsense. That was one element of training that we had to do, the management and governance distinction. So we were supporting governors in knowing where the limits of their governance was. Secondly, of course, the limits of what was available if they had not developed reserves. And lastly, by elections, Chairperson, DBE requires governing bodies to be fully stocked with parents. And so by-election training is something very important, which we want to do online. Thank you so much for the opportunity.
Thank you for your time. Yeah, we can certainly have these discussions for a long time. Last point on this, Member Murray, you say one of your questions was answered.
Sir, yes. We heard here that consent was given for a deviation from directions, and I think this was said by Mr. Lebogang Monjani Isasa. So I would like to know, what deviations is he talking about? Because a deviation from an instruction, we need to know what instruction was not observed and who gave permission for deviations.
Thank you, Member. Member, any other member's question who's not been answered, so we can just close this round, please. That has not been answered.
Yes, Chairperson.
Okay, Member Kleho.
Yes, man. Is that one that I wanted to know regarding the issue of school fee increases? That what is the understanding of the ISASA as far as that is concerned? Because there are schools such as Observatory Primary that have embarked on that. Yes.
Okay, thank you, Mr. Macho. Do you want to conclude those questions, please?
Thank you, Honourable Chair. The directions from the National Department of Education, as issued by the Minister, indicated that if a school wanted to bring in different grades earlier than those set out in the directions, they can apply to the HO, head of department of their province, to deviate by indicating which grades they would like to return back to school. That is what the Western Cape Department of Education indicated. So all schools in the Western Cape had to indicate that they were compliant with the COVID-19 provisions, that they were doing social distancing, and instead of, for example, permitting grade 7 to come back, they'd rather have grade 4 come back. They just simply indicated who was going to come back and why. And that it was not only the Western Cape, that was around the country, as I indicated. Gauteng also gave those deviations, but that came out of the law itself. So it was a legal act. In terms of school fees, Chair, Observatory Primary is not a member of ISASA and it's not an independent school. However, many schools are actually going to be increasing fees, but we as independent schools are seeing that the fee increases are much slower than previously, such as 3%. But we as an association are not increasing our subscriptions for next year for our members. But they are going to be school fee increases, but I suspect they're going to be much lower. And that is what's going to happen. Thank you, Chair.
Thank you very much. And let me take this opportunity to thank our organizations for coming this afternoon. It is really appreciated, and we thank you for taking the time to come and do your presentations to those committees. And I really want to thank you for that. And thank you for coming. You are now excused. Members, we already 6 minutes past the hour, and I don't want to keep you here much longer because I do know that you have other engagements. I just want to inform you that SANASA, which is South African National Association for Special Education, that was invited to the committee, has indicated they will give us a formal submission in the next 2 weeks. So they will, the chairperson, when she's back, will deal with that matter. But I also like to propose that, seeing that we are over time, that the minutes of the meeting, of the previous meeting, can stand over to the next committee, which is on Friday. And unless there's anything urgent members wants to raise now, I would again further encourage you to, any additional or resolutions you want to put to this committee, that you do so in writing by the 24th, or any additional questions to it, to our presenters currently, please do so in writing by the 24th. And I want to thank Mrs. Aida Adams and Ms. Kluter. Thank you very much for your professionalism as always, and for your help in making this meeting possible. And to wishing members, is there anything urgent, member, that needs to be aware of before we conclude this committee meeting? Thank you. There seemed to be nothing. Thank you for your time, members. Thank you. I do apologize for running 10 minutes later. I know you have other engagements as well. This meeting is therefore adjourned, and we will see you at the next meeting. Thank you.